We've got other presenters here. Glenda, are you ready to come to the podium? That's yours. Glenda is the executive director of the Georgia Rural Health Innovation Center, and she has a program for us, and we're just glad to have you, Glenda. Thank you so much.
Thank you so much for allowing me to come. I did want to tell you, the last time I spoke to your group, I had been on the job for 7 days. So this time I'm a little more prepared, and I'm awfully glad to be able to come and speak with you all and tell you a little about what we do at the Georgia Rural Health Innovation Center. First, just a little reminder, a refresher of who we are. We're the Georgia Rural Health Innovation Center. We exist because of you, so thank you for that. We were constituted by legislation, and we appreciate that and your support of us. We were placed at Mercer University School of Medicine because the mission's so closely aligned to take care of rural and underserved Georgians. And so that's why we were placed at Mercer University. And so we're there to improve healthcare through research, but also sustainable solutions. One of the first things that was said to me by the chairman at the time, by the Rural Development Council, was, "We know it's a problem. What are you going to do about it?" And I think about that every day. I say it to my staff at least once a week. We're there to find solutions. We're there to help rural Georgians. Rural Georgians are special, and they're wonderful, and they're resilient, and they know what they need. They just a lot of times don't have the means to get there. Most of us at the center, I am a rural Georgian. I'm proud to be, and I'm grateful for that. I drive into Macon, but gratefully drive back out. I'm glad to get into the communities and work with Georgians. And so that's who we are and what we do. I want to talk a little bit about, I'm going to blow your socks off with some mental health statistics. I heard you say earlier, a lot of what we do is through mental health. COVID didn't cause the things, but it did shine a very bright, hot light on mental health issues in Georgia, and in particularly in rural Georgia. So more than half of Americans report that COVID had a negative effect. We know that, right? But in February 2021, 44.3% of adults in Georgia had symptoms of anxiety and depression. The more startling part of that is 30% were unable to get the counseling and therapy that they needed. Georgians are 4 times more likely to be forced out of network for mental health care. 4.9 million Georgians live in a community with few to no mental health professionals. That's a pandemic all its own. That's disturbing. 7 in 10 youth in a juvenile justice system have mental health conditions. That's even scarier, but you'll see why that makes sense in just a moment. More than half of people with a mental health condition in the U.S. did not receive treatment. That means that 391,000 adults in Georgia did not receive mental health care that they needed. 45% because of cost, and the rest were because of access. 1 in 6 U.S. youth aged 6 to 17 experience a mental health disorder. That means 104,000 Georgians aged 12 to 17 have depression. And then what that means ultimately, those high schoolers with that depression are 2 times more likely to drop out of high school than their peers. 68.4% of Georgians aged 12 to 17 who had depression did not receive care. That's an unbelievable statistic. And so with that in mind, what are you going to do about it? This was the answer that we came up with. During the pandemic, we were called by one of the school systems. They had been out of class for 1.5 years at that point. We're still attending virtually. They had had 4 suicide attempts in that school system with less than 300 students. That's an unbelievable rate. And so COVID revealed that critical need. It shone a spotlight of what already was a problem. So we knew that the children needed this care. So we began looking, why can they not receive care? The safety net in Georgia is a wonderful thing, but often the safety net don't have providers. So we began looking at that. Why is that? Why do they not have providers? And we learned that many of the people who had graduated with this graduate degree for behavioral health had to get supervision. They had to pay for that. That's thousands of hours of supervision that they needed. So they're working outside of their field because they have to pay for these supervised hours. They can't charge insurance for that. And so we had this backlog of children who needed to be seen in schools and these professionals who can't get into the field. And so we thought, okay, what if we put them together? And it was like lightning in a bottle. We began to give services to children by telehealth with these professionals who needed these hours to satisfy both ends of that need. And it was fantastic. We started to get calls from all over the country about how are you doing it? How does it work? It works great. Telehealth done very well, high quality telehealth done well. Is a wonderful alternative, especially for mental health care. We're now in 16 schools and 4 systems. We have 4 systems waiting now. Our backlog. We need more providers. We need providers and people who can supervise those providers to see the children. It's a benefit for everyone because there's no cost involved. The children don't have to pay for the care. The providers don't have to pay for supervision, but we need those practitioners. So I took what you said, how can you help? This is how you can help. Encourage the colleges and universities in your area of influence to join our free clinic. We set up this free clinic structure so that they can come in without having to worry about liability and those things. They can come in and offer that assistance. We need supervision for graduate students for this program. We've reached outside of Mercer. We've tapped into all of the programs that Mercer, we're at full capacity now. And so we've reached out to Georgia College of Nursing to help us come alongside us. We're talking with Valdosta, and we've had some interest from UGA. So we're very proud and excited to be able to expand that program until we can see all of the children that we can reach with that program. Another thing, a great thing about rural Georgians is that they help one another. We have to. Right? We don't often have the resources. We just talked about the need for mental health professionals in rural spaces, and so we don't have enough. So what do we do in the meantime? Well, we offer mental health training through the center, and this is really neighbors helping neighbors. Everyone in the center is certified in some type of mental health training. We offer assist suicide training, mental health first aid, QPR for suicide prevention, and then community resilience model mental health and wellness training. I particularly like this one. I had everyone in the center trained on this because it offers a toolbox for someone. And a lot of training, you go, you hear it, but it's hard to put it into use. CRIM training allows you to put that into use right away. Anybody from toddlers to the elderly can use it. Anybody can teach it. It is a toolbox of skills to keep people in that resilient zone. It's a wonderful program, and to date, we've been able to do over 1,600 trainings in rural Georgia. We just got finished training everyone in Washington County, all the 8th graders in Washington County a few weeks ago. We want to get this into everywhere. 800 teachers have taken that training in the past 3 weeks because it helps them tremendously with classroom management and being able to help those children to stay within their resilient zone. We've heard many stories of those children going home and teaching their families then how to stay in that resilient zone. So it's a wonderful program, and we're very excited about that. So how can you help? Talk to everyone you know and encourage them to train their communities. We offer all of this training for free. Some of the platforms, Mental Health First Aid, QPR Assist, those different ones cost, but we absorb that cost. We only pay the national boards that require that, but we don't take any payment for that, and we do that for free. So if you have areas that you would like trained, please let us know about that. Reach out to me. Also, we do a lot in churches because that seems to be a wonderful place where faith and healthcare meet. Taking care of the whole person. So we do a lot of training in churches as well. So schools and churches are our main fertile ground for that. Another highlight I want to tell you about is the Georgia Agricultural Wellness Alliance. Taking to heart again, what are you doing about it? We did a study a little over a year ago. We were looking for mental health statistics for farmers. And we did not find any large studies that encompassed everyone, farm workers, farm owners, and their spouses. And so we did one. And it's to date the largest farm worker mental health study that's been done. And we had over 1,600 participants in that farm workers. I want to point to a few things. Healthcare access, 60% had no access to basic medical care. And we knew from farmers from the study that the number one person they talked to or would be willing to talk to was their physician. This tells us they don't have that. The next person was their spouse. their spouse didn't have a physician either. 60% did not have that. 50% had no health insurance. Then for suicidal ideation, 29% thought of dying by suicide at least once a month. 42% had thoughts about dying by suicide in the past 12 months. And as disturbing as that is, it is nothing compared to the first generation farmer. If you look up in the generational status box, you see that first generation farmers have a higher stress score, fewer coping mechanisms, and I didn't say healthy coping mechanisms, I just said coping mechanisms. They have less healthcare access, less than 60%. And the truly terrifying part about that, their suicidal ideation, 61% had thoughts of suicide in the past year, and 9% thought about it every day. 9%. That's a pandemic all itself. These are the people who take care of us. These are the folks who feed us and who make our lives possible. This is not okay. And that's why we had to put teeth into that. And we began the Georgia Agricultural Wellness Alliance. We housed that at the Innovation Center. We pulled together people who were working in that field, the Department of Education, the University of Georgia, DBHDD, and the Georgia Foundation for Agriculture. We cannot afford to have these services siloed and not in the hands of the people who need it. We're at mission critical. We've seen that 9% thinking about suicide daily. We cannot afford to lose one farmer, much less that. And that's the people who are coming into farming. That's who's going to carry this on for our futures. So it's very important, and we're very excited to be able to house that and to have the people that we do working on it. So we're gathering the resources now. We've hired a director within the past 2 months, and just last month we began our strategic plan of how we're going to tackle this and how we're going to ensure that farmers have the services that they need. We don't want to lose one more farmer. It's unacceptable. And so that's the Georgia Agricultural Wellness Alliance. How can you help? Continue to listen. Continue to listen to that agricultural community. They'll tell you what they need. They're not a shy group. They'll tell you what they need, but we can't afford to turn a deaf ear. And we need to customize and get them the help that they need. We need to make that happen. And the Georgia Agricultural Wellness Alliance is pulled together to ensure that that happens. The last one I want to talk to you about is the opioid crisis. I think these are staggering statistics. From 2019 to 2021, fentanyl-involved deaths increased by 232%. This is the one that punches me in the gut. The number of young Georgians who died from fentanyl-laced drugs overdose spiked last year by 800%. In 2022, Georgia had a record-breaking number of overdoses for fentanyl. We're going to break that record this year. Cobb County has the highest overdose in Georgia. Carroll and Henry have the highest fatal overdoses. But Wayne County and Rabun County are right behind them as the rural counties with the highest overdose rate in rural Georgia. This is the statistic that I think you need to pay particular attention to. Georgians with chronic disease and/or mental health diagnosis are more likely to misuse opioids. What we learned during the pandemic is that it was not shocking where people died from COVID. If you overlay a map of health disparities onto the deaths that occurred by COVID, they're the same. The people that were unhealthy before COVID succumbed to COVID in the end. We're seeing a picture painted right here of the very people who are suffering from addiction and opioid use and overdose. It's our chronic diseases and mental health. That's why it's so important that we address these. They're a big deal. So what are we going to do about it? We've partnered with the Christopher Wolf Crusade. It sounds like a religious organization. It's not. Cammie Wolf Rice is a wonderful human being who unfortunately lost her son Christopher to overdose. His fight began when he was in middle school, and he had some surgery for a chronic disease that led to many more surgeries, 8 in fact. They sent him home with 90 opioids, quickly followed by another 90. And she says, I was a mother who loved her son. I didn't want him to be in pain. I did not know better. And so I gave them to him. And from that moment, it hijacked his brain. And that's what we've got to fix. And so she created the curriculum for the life care specialist. And we're developing that at Mercer. It's an online curriculum that people can learn the online curriculum and then go to their practicum in the communities, the rural communities where they're going to serve. This teaches them, it's everything that Cammie wished her son had. They see this life care specialist. It's modeled off of a child life specialist, but they see this life care specialist before surgery, so that they get the true expectations. We're a society that thinks there's no pain, right? You can take a pill for that. There's a pill for that. If you don't believe it, you can see commercials on television all the time. There's a pill for that. But we need to realistically talk to people. You're going to have pain. This is a big surgery. There's going to be pain after that. But there are alternative ways to handle that pain. Let's talk about, have you had issues with opioid misuse in the past? We're not going to give you opioids then. We're going to talk about that all in the beginning. Do you have someone in your home that has had issues with abuse in the past? We're not going to send you home with 90. So talking about all of that, then this life care specialist is with them in the hospital. Often nursing staff is stretched very far, and they're taking care of a lot of patients. They don't have time to address pain and come up with alternatives to medication for pain. That's what the life care specialist does while they're in the hospital. Then they follow up with them after. This is how long you should expect to be in pain. This is how long, this is how bad it's going to be on day 4. This is when you should start feeling better. And so it coaches them through that pain and through that disease management. Gosh, I think about my parents and us and things we've been through in the hospital. Wouldn't it have been nice to have had that person there to walk alongside you, to be someone that you didn't have to grab as they're running to the next patient, to ask all of these questions and to help you to manage that pain so that you knew a little more? I think of myself as fairly, versed in the healthcare field, but there are lots of things I don't know. And this person is that bridge to bridge that gap to help in that. It also, that curriculum offers continued education for physicians and advanced practice providers. So our goal is to put 2 of these life care specialists into 5 rural hospitals with the thoughts that they will train together in those 5 hospitals. Then after 1 year, they'll leave and go to another one. And we'll leave one in that same hospital, go to another hospital, we'll hire another person there until we spread that web of life care specialists across rural Georgia so that every rural hospital has that life care specialist. So how can you help us? Well, I've given you a goodie that's a little bit strange today. In your bag that I provided in there, I do have a folder in there for you that's got some information about our study for the Agricultural Wellness Alliance. But what I've given you is 2 boxes of Narcan. What we need to do is stop hiding that people aren't using drugs, is to talk about the importance of keeping people alive, to talk about addiction. I would venture to say every one of us knows somebody in this room who knows somebody or within your family that has someone who deals with addiction. It should not be hidden. Cammie didn't talk about her son's death for 2 years because she said, I didn't want him to be stigmatized by that. But then I realized I had to talk about this. I had to let other people know there should be no one who dies of addiction and opioid misuse. So I want you to take that Narcan. I want you to keep 1 box for yourself. You can't hurt anybody with it. You can give it to them. It won't hurt them if they're not having an opioid overdose. You can administer that to them, but I want you to take that other box and give it to somebody you know, because you know somebody. You know somebody with a child or a loved one who's struggling with addiction. You know somebody who has a large group of people who come to them regularly. Chances are somebody is struggling with addiction in that crowd. You can save a life. It is not worth being silent over. We can't do that any longer. So take that, educate your community. Talk to them about it. Don't be afraid to talk about it. We need to let people know. Remember, chronic disease and mental health issues are the reasons why people struggle with this addiction. They're much more likely to struggle with addiction, particularly opioid addiction. So that's how you can help us with that. One more thing, I couldn't talk about everything today. I'd love to tell you about every project that we have, but you'd be here you'd be exhausted. But I have included in your folder, this is not a comprehensive list, but it is a robust list of what we do. You can see on the map, the orange is rural counties. We only work in the 120 rural counties as defined by the state of Georgia of 50,000 or less. And so there are great things happening in other places, but we love and support our rural counties. And so we have at least one program in the center in all of our 120 rural counties. If you see something on this list and you want us to be a part of that, I put a card in that folder, in that black folder for you. Please don't hesitate to reach out and call us. And we would love to come and be a part of your community as well. This is how to contact me, but again, you have it on your card. And are there any questions?
Do we have any questions?
Yes, sir.
Thank you, Mr. Chairman.
Even if I have to tell you, I'll find out the answer. I'm good at that. I will tell you, before, I did have part of my staff that are so smart, and so they were hiding behind the teleprompter to help me out. So,
Chairman Mac Jackson.
Thank you, Mr. Chairman. I just want to thank you for the services that you're providing in Washington County and in Jefferson County too, because I can tell you from personal experience how much it means to the citizens and the school system for what you do, and also for the healthcare clinic, the health clinic you've been helping me with every spring, and we're already planning our next healthcare clinic already for 2024. So thank you for everything you do. Mercer has been a great asset to us here in Washington County and in Jefferson County. So as an advocate, I'll keep telling people, and I'll stay on Hancock County too.
Good.
To make sure that they get the services that they so much need. But thank you.
yes, sir. It's our privilege.
Thank you so much. We appreciate the presentation so very much. We appreciate what Mercer University does for all of Georgia. Rural Georgia is greatly indebted to Mercer for the many projects that and that has made a difference in our community.
It's an honor for us. Thank you.
Thank you so much. We appreciate that. Next will be the Amwell Telehealth. That's mental health services here. Jenna and Rhonda are going to be speaking. I had the opportunity to meet them earlier today, and they're going to do a presentation for us now.
So good afternoon. I am Jenna Novkovich, Senior Regional Sales Director for Amwell, joined here by Rhonda Schauderix, Director of Behavioral Health, and we are with Amwell. So Amwell is a 17-year-old telehealth company, and it's so funny to talk about telehealth because I've been with the company 9 years, and when I tell people I sell telehealth, before COVID, everyone said, what's that? What's telehealth? And after COVID, no one asked me that question anymore. So it's really changed a lot in the healthcare space. And I'm going to talk a little bit about that, especially when it comes to COVID. But today, what we're seeing in all of the major health systems is a combination of in-person care, automated care, and virtual care. And so I want to spend a couple minutes going over what some of our clients are doing today and tell you about how they're affecting the rural communities. So our partnership with WellStar, the Medical College of Georgia, formerly AU Health. For the purpose of this, I'm going to call them AU Health. But Amwell partnered with them in 2019, so that's pre-COVID. The footprint at AU Health is they are 2 main hospital locations, a critical care access facility, over 80 outpatient facilities, and they serve 24 counties in Georgia and South Carolina. So they were funded with a grant awarded to them by the Department of Agriculture, and they rolled out critical care programs to those 24 rural counties in Georgia. So these are things such as stroke, critical care, pulmonology, cardiology, really just critical care use cases. And they've been able to roll out telehealth so that when the patient comes in, they are able to wheel in a telehealth cart and then meet with a specialist provider from afar. And what that does is that decrease transfer rates by 80%, and it keeps the patient inside of the rural hospital that they're there, and so that they don't have to go to another facility. Also in 2020, AU Health had to escalate their plans by putting together a on-demand virtual urgent care solution. And so if you look at the timeline of that, most of the patients that they saw were COVID-related patients. So these are people who could just get on the internet, either their PC or iPhone, and say, I'm having these symptoms. Do I have COVID? Do I not have COVID? Do I need to come into a facility? Do I not need to come into a facility? And they were able to treat 87% of those patients just virtually and keep them in the home and help maintain that. Another one of our clients is the flagship of Wellstar. So this is more of a recent initiative here in 2023. So Wellstar, as everyone knows, is 9 hospital locations, over 800 outpatient facilities, and serves many counties around Georgia. They have seen a significant decrease in the number of nurses that they've been able to hire and staff, and that puts a large burden on the nursing staff that's currently there. So Wellstar rolled out a virtual nursing vision, and they're doing this in their Paulding County Hospital location. The goals of this is to redesign the model of care for nurses, alleviate nurse burden, and positively improve and impact the patient experience. So something that the way that this works is we put a small camera on top of the hospital grade smart TVs, and then a nurse who's not physically there, or maybe she is physically there, but she just saves the time of going from room to room, is able to assist the bedside nurse. So this is tasks such as patient education, medication management, discharge, double checks, things just really to keep the bedside nurse with the care, and then having someone else alleviate some of the other tasks to really help with that shortage. Another thing that we're seeing is a lot of nurses are reaching retirement age, and they have a very large interest of maybe doing patient education from within their home and just hopping on their computer and answering questions that way. The final use case I'm going to talk about before I hand it over to Rhonda to go over behavioral health is something that we're doing with Prisma Health in South Carolina. So this is the product of a huge acquisition between Greenville Health and Palmetto Health. And this is where the automated piece comes into this. So I'll preface this with, it's not ChatGPT. This is automated care. And so what this is it's a symptom checker. So they rolled this out also during COVID. And so it is a chat text-based app that you can just go ahead and download and go through some different symptom checkers, and it comes back. What this does is it keeps people out of your emergency room, and then it also alleviates any sort of transfers or things of that nature, but it helps get care to people from within the 4 walls of their home. So with that, I'm going to hand it over to Rhonda.
Thanks, everybody, for allowing us to be here today and talk with you about solutions we're doing for rural communities. I'm hearing a theme with mental health, and that's what I'm here to talk to you about today, is what the services and solutions we're providing in rural communities with our Amwell Digital Behavioral Health Solution. So before I dive in, I just want to ask a question, and I want you to think about this for a second. What does anxiety and depression look like to you? Like, what pops into your mind? What do you think about? It's probably something that looks like this, right? This is kind of what you think about when you think about anxiety and depression and how mental health is. But what this does, it really creates a false and misleading assumption that we can always see anxiety and depression. But in reality, these are what people that are suffering actually look like to the outside world. They smile, they get together in groups, they show up in Zoom meetings. And we know from a SAMHSA report that 1 in 3 adults will experience a mental health illness in their lifetime. And even just the presentation prior to us with those statistics, no surprises there. A lot of people are experiencing mental health illness. We actually did a survey to employers around the nation, and we asked, how are you feeling? And over 50% of people would say they're fine, but they're completely lying. 50%. This is what they really look like, people who are struggling. They can lose interest in everyday chores. Some people have physical pain. Some people mask and alcohol. So just because they look like they're smiling on the outside doesn't mean they're suffering any less. And I know this from a personal experience because that young lady on the top right-hand corner is my daughter. And 7 years ago, it was about 7 years ago, gosh, time flies. So she was a freshman here at the University of Georgia. Go Dogs. We had a horrible incident happen in our family, and I needed to find her grief support. I called the Student Counseling Center. Now, this is 7 years ago, so I'm going to talk about how we've come a long way since then. But I called the Student Counseling Center. There was a wait list. I called around the therapist in Athens. The first available appointment I could get for her was in 7 weeks. And I couldn't get her off the floor, like right now. So it was a mom that just made me feel hopeless. However, now we fast forward 6 years later, right? And in January, when we had the tragic car accident of the football player and the administrator, now that UGA is a client for Amwell, we were able to open up our digital program for grief and loss. And we were able to open it up to faculty, to staff, to the students, to a community that was grieving. And we were able to do that within 24 hours. We were providing that care and support. So we've come a long way in 6 years. And I was listening to the presentations earlier, and Chairman Clay Perkle, I don't know if he's still here. Okay. Yeah, he brought up a good point about intervention and getting and recognizing mental health early and being able to make a difference before you get into a crisis mode. So some of the challenges that we're looking to help solve for the rural communities, and these are probably no surprises to you, but the first one is time and transportation, right? Like my daughter was in Athens. I probably could have gotten a therapist in Atlanta, but that was going to take her 2 hours to travel. And she's, didn't have that time. So we have to really consider, the distance that it takes. And that's a key barrier to access. We also know that 60% of U.S. counties do not have a single psychiatrist within their border. I think it's pretty consistent with what we've been hearing about today. We know that there's a problem, but the real problem is that's not going to get any better because more therapists and psychiatrists are retiring and moving on, and we're having less enter. And the same study that talked about the 60% of U.S. counties not having a single psychiatrist also talks about 39% of psychiatrists are burned out and overloaded. So it's going to continue to be a problem, that access to care. And these are the problems we're looking to solve for our rural communities. And the second one is stigma. And I think this is changing. Like the conversations I have, I'm starting to see more people opening it up to that. But in rural communities, there still is kind of that self-imposed barrier of resiliency should be a virtue, should be a self-virtue. And there's still that lack of trust in the confidentiality that seeking mental health treatment might have. Maybe your neighbor sees you and you don't want them to. And then there's fear of negative judgment. So we're working to help solve these problems by providing a solution, combining all of the Amwell technologies into a solution that is providing our members and patients the right care at the right time. and then the confidentiality of their own home. So how that begins is really with an automated care check-in. As Jenna mentioned, it is an automated conversation, but the goal here is to get somebody engaged that might otherwise not know about the programs or, so we're getting them immediately engaged, and then we're identifying where they are in their well-being journey, in their mental health as well. So we know we have an understanding, what do you need right now? And how can we provide you the next best level of care? And what does that look like? And we're combining again the AMWEL technologies of providing the virtual telehealth visit with a provider. And instead of 7 weeks, we can do it in a day. And with psychiatrists, it might take a couple of days, but we're seeing somebody in a much quicker way. We also have community support that we can have as part of that overall experience. Maybe they don't have a high acuity level, and maybe just some education pieces or mindfulness exercises or things to just kind of help them get less stressed out. And then we also have a digital behavioral health program that is cognitive behavioral therapy. So that is more for anxiety and depression and help solving for those problems. Throughout this process, we have the ability to escalate and de-escalate if, for example, life were to happen and maybe you need more support. Okay, I've been taking a digital program. Now it's time, I need to get more support. I'm dealing with some issues at work. Just go ahead and see a provider. But the idea is to provide the right level of care at the moment that you need it. But at the end of the day, none of this really matters if we're not getting outcomes and we're not getting people better, right? So we're highly focused on making sure that we are getting people better. Our cognitive behavioral therapy programs, again, cross the gambit from well-being to the higher acuity type of programs. And after we've had over 1 million users, we have a lot of data that we can present, and we're getting people better. And we're getting them significantly better. So, the difference between getting them a little bit better and significant is the difference between a student going out for a run and feeling good. Okay, I've maybe scoring a little bit better on my assessment scores, but I am now showing up for class. I am now graduating. We have employees that are showing up happier, more productive at work. Those are significant improvements, and that's what our programs do. We also were published in Nature Digital, and we did a study that we measured improvement of our members for up to a year. So what we found was even the people taking our programs, they were improving and they were getting better, but they were continuing to improve over time. So up to a year, we're still seeing improvement. So what that's telling us is what they're learning in these tools that they can take in the privacy of their home any time of day or night. We're seeing that they're continuing to get better. Okay. So what does that mean for the state of Georgia? And what have we been working on here? So as Jenna mentioned, we have the relationship with Wellstar. We've been working with the University Systems of Georgia. So working with the University of Georgia and the other school systems as well. We were awarded a statewide contract 2 years ago. The Department of Administrative Services sent out an RFP, went through a very long, diligent process, and found and selected AMWEL to be one of the providers through this contract. So what that does is it easily enables us to be able to contract with agencies within the state of Georgia. And as a result, we've been having conversations and talking about ways that we can help some of the state agencies with their mental health initiatives, looking to implement a automated care program with the Department of Behavioral Health and helping to support those employees so that they can be better in supporting their patients. And then recently, this is very exciting news, AMWEL was selected in partnership with Leidos to provide services to Defense Health Agency. So we are going to be providing support for over 9.6 million personnel members of our military, the retirees, and their families. And we're just beyond excited about being part of their strategic initiative to have the military be more person-centric as a healthcare system. And they have selected mental health as their #1 priority. So as a result of that contract, we are going to be doing a pilot program in Fort Moore. So we will be starting a program with Fort Moore, and then there's a couple hospital systems in northern Florida as well that that we will be supporting. So we're very excited about that. It's an incredible mission, and we are just honored to be a part of supporting our military personnel. And basically, this is just kind of the contract for convenience that we have with the state of Georgia and what it covers. But, you know, we're just really grateful that we have this opportunity to support, you know, organizations throughout Georgia, especially in the rural community. And, you know, we're happy to partner with you along the way. So, and I'm looking at the clock. I'm right on time.
Great. Yeah, that's a great presentation. Do we have any questions from the audience? Members of the committee? Okay, yeah. Chairman?
Thank you for your presentation and your personal testimony there. Walk me through how this works. Can you elaborate a little bit more on that with the telehealth? You know, perhaps on your phone, and how that works.
So we could probably talk for a whole day. Oh, I'm gonna move over here. We could probably talk for a whole day, and there's a couple different components. So are you speaking specifically on the mental health side, or are
On
you
the mental
thinking
health,
more
yeah.
over? Okay.
I'm talking more the mental health.
Yeah. So so what we're looking to do, and I can maybe back this up a little bit, is you know, there's a combination of AML technologies that are part of this overall solution, right? And the first one is that automated care piece, and that's that immediate engagement. And, you know, we can get started a number of ways. And it's really interesting because we do work with over 200 university systems, for example, around the US. And we're finding really creative ways to get students engaged. And one of the ways that we're doing this is providing QR codes. So we can put QR codes on bus stops, for example. We have an initiative going on with one of our universities called the Commode Code, where we're putting them in the bathrooms because that's private and they can start a conversation about mental health right there and then. But it typically starts with a QR code, and then you can take, and it's very customizable. So we can set up that process and that pathway to look as exactly how the organization would want it to look. For universities, for example, Bowling Green State is one of our clients, and we're doing a well-being assessment right up front. So we're understanding where they are, not just from a mental health perspective, but also from a well-being perspective. So if they need financial support, for example, we can identify the resources and direct them to student financial aid. If they want to work in a physical environment, we can let them know where their gyms are. They're in a mental health crisis, we can send them to a crisis counselor. So it's really just about understanding where that person is in their journey and then what makes sense to go where. And along the way, checking in to make sure that they're on the right track, they're taking their digital program, for example, they're feeling better. If not, okay, let's go talk to a therapist. And then we can direct them into the therapist. Does that answer your question?
Yeah, that helps. Thank you.
Okay, certainly.
Thank you. Do we have any others? Well, thank you so much. Y'all
thank you.
have really brought to the table some very interesting points, and we will be in contact with you as we write our proposals.
Yes, absolutely. We're here to help.
Thank
So,
you.
Thank you. That's us.
Thank you. Our next presenter is Children's Healthcare, Mercer University. We have Dr. Jean Sumner, the Dean of Medicine at Mercer University, and John T. Smith, the Vice President of Government Relations of Children's Healthcare. Let's welcome them as they come.
Well, thank you, Chairman Jackson,
Thank you.
Chairman Green, and Council for giving us a chance to come present to you today. My name is John Smith. I'm the Vice President of Government Relations for Children's Healthcare of Atlanta. We are here to talk about our work with Mercer University School of Medicine and the Rural Health Innovation Center, and very, very thankful and appreciative to be able to share the podium with Dr. Gene Sumner. Before, I'm going to let Dr. Sumner do probably most of the heavy lifting today, but before I get into that, I want to give a little bit of an overview of the patients that Children's sees from all across the state, and then a little bit of the background of how this affiliation between Children's, Mercer, and the Rural Health Innovation Center came together. So a little bit of the background. If you look on the left side of this slide, the state of Georgia outline, Children's operates 3 hospitals. We have the Scottish Rite Hospital, which sits on 285, the Eggleston Hospital over near Emory's campus, the Hugh Spalding Hospital, which is in downtown Atlanta, and then Children's operates the Center for Advanced Pediatrics, the Marcus Autism Center, and our urgent care centers. And so out of that footprint, last year we saw nearly 1.2 million patient visits. And out of that 1.2 million patient visits, we saw kids from every county in the state, all 159 counties. And so that's something that we're very proud of. We treat your constituents, every Senate district, every House district. Just to take a brief moment just to kind of highlight something new and exciting going on at Children's. This is the Arthur M. Blank Hospital that's currently under construction, which is replacing the Eggleston Hospital. I bring this up just to kind of highlight, like I mentioned, currently Eggleston sees patients from all of your districts, from every county in the state. And so this is a replacement for Eggleston that is on 85 in North Druid Hills, which is less than 1 year from completion. So hoping to have an opportunity post-session to invite all of you out to see that. Really, this is kind of a once-in-a-generation type project, very cutting edge and very exciting for us. So as I've mentioned, Children's historically has had a statewide focus given the patients that we see. A few years ago, Children's took a more narrow focus on really an internal question of what are we doing to advance pediatric health care in rural parts of our state. And early in that process, our Board of Trustees set up a $200 million sustainable long-term fund to support that work. And additionally, early in that process, we had the good fortune of being able to connect with Dr. Sumner, the Mercer University School of Medicine, and the Rural Health Innovation Center. And really the core of this work, everything that the overarching goal of this is to provide timely, quality care close to home. And so that is the driving goal and mission of this work. And that is really our focus with these pilots and working with rural hospitals, rural pediatricians, and then the Pediatrician Scholarship Program. And so with that, I'm going to turn it over to Dr. Sumner to kind of dive into the pilot areas that we're working on, and then happy to answer any questions with the work where it sits. Thank you.
Thank you. I'm honored to be here, and thank you for all the work you do for rural Georgia. Everything we do at Mercer is focused on rural Georgia, the 120 counties, and we're very serious about that. We're proud to house the Rural Health Innovation Center, and I think you see that we're really doing a lot of things across the state. But the most important message you can leave here today about this project is this is a true effort to keep children close to home and to prevent disease rather than transfer them. And so we laid out a plan, and Children's was generous enough to help support this effort. It's a 10-year commitment. That's a long time. We started in March, and we started with 8 rural hospitals. And John said this, but these are the things we're doing to keep the children close to home and make sure that pediatrics is available and the primary care doctors who care for these children have the resources and the skills they need to do it well. But I'm going to skip this because we've seen that, but we started with these 4 initiatives. And first was rural emergency room support. I think that if you think about rural emergency rooms, they often transfer children rapidly to the next level when they might have been able to care for them at home, but you want what's best for that child. And so if you do an analysis, it's often that the emergency room may have a retired surgeon filling in, or they don't have board certified ER doctors often, or they have a doctor that's not familiar with the children, and they don't want to make a mistake, so they transfer the child. That's very expensive and very disruptive to the family, and often those children come home quickly, but they've been flown to another city. We started with this, and this is the counties in orange are the first years. We started in March, and we picked 8 rural hospitals. And we went into those hospitals and have a team that works with them with the guidance from some of the children's experts. And we did an analysis of their emergency rooms. And I can tell you, I've done a lot of things in my life, but calling these administrators to ask them if they wanted to be part of this project was one of the most emotional minutes in my life. Some of them started crying. They often said, we've been praying for answers for children. And we have received tremendous support from the administrators and the staff that work in those hospitals. So we've built a team around them to help them to grow and to support, and we're doing several things. One is to create the skills that they need to care for these children. We come in and train them, and today we take a group of nurses and staff to Children's periodically through the year, and they get to spend a couple of days at Children's going through their simulation, looking at their emergency room, looking at the care, talking with nurses that do that work, and we'll continue that training over the course of time. We'll train every ER department in these 8 rural hospitals. And this is the last batch, I think, for the first 8, and we're naming 5 more hospitals. All of those hospitals are engaged, and we have an alliance of those rural hospitals with the staff and the administrators involved in that. Last week, we met with all those individuals in person, and I was able to meet with them briefly in Sandersville. They all came, and what was amazing to me was the interaction between those teams, and they come up with the solutions they need. They tell us what they need. They very much want to be the best they can be for their communities. One thing you may have seen was the Wall Street Journal on October the 1st. The front page said that children are dying in emergency rooms. And I thought when I read that article that everything they pointed out that needed to be done, we started last March. We're doing all of those suggestions. I had the opportunity to speak to the lady who wrote the article. There were 2 authors, but one of them called to interview me and after the article. And her question was, how are you going to keep them doing this? You're going to go in and train them, and how are you going to make sure they're doing that? You know, these are people. I said, where do you live? And she said, New York City. And I said, well, obviously, you've never been in a small town, because when a child comes in your ER, your daughter may be in the same class. You know their mother. The lady at church is their grandmother. You don't have to force them to continue to do good. They want to do good. They take pride in their hospital, and they want to provide for children. And so she didn't publish anything, obviously, but she did get my opinion on that. But these are the things that we're planning to do, and this is a short list of the many things we're doing. We even go in and assess the equipment they have. They often don't have the equipment, and with children's guidance, we've done an analysis, and we're providing that equipment. We're providing everything they need to take care of children, but we're also putting in a high-quality telehealth unit, not just a video chat, but the ability to examine a child in that ER from a specialist at Children's or any of the regional hospitals. I've spoken to members of the staff and leadership of all the regional hospitals, Memorial, Medical College of Georgia, Columbus is building one, Navicent, and they're all willing to take part in that. We do not want to disrupt referral patterns. But even at that, I'll use Clinch as an example. Clinch is a great hospital, but they don't have a pediatrician in Clinch County, but they do in Douglas, just up the road. And so you could maybe send the child to Douglas for care. Moultrie has some inpatient pediatric beds, and they're going to be in our next round of hospitals. And so we hope to add to that and continue to build on that. We also are working with pediatricians, and eventually we'll add family medicine to this because family medicine does take care of a lot of children in our state. But we put in high-quality telehealth units in these pediatric offices. One of the things about being a rural doctor is you want a second opinion from your colleague, and you're the only person in the county, so it's hard to get. And your patients maybe can't afford to drive to the next county. So now a pediatrician in Sandusville can get an opinion from a pediatrician in Dublin, or a pediatrician in another county, or a pediatrician at Children's or Augusta or Navicent, Atrium. So those things are very important to sustaining a workforce. You become very lonely and isolated if you don't have a colleague. We've selected a telehealth champion in those offices, and we hope to establish clinics. So if a child has to go to Atlanta for chemotherapy or some major procedure, they may be able to follow up with that specialist from one of these regional hubs because they have the ability to examine that patient and eventually develop clinics in many of the areas that are needed for specialty care. Mental health, and Glenda covered mental health from the center's position. They do a lot of amazing work, but we also have been screening children. We spend a lot of time in these rural counties, and if you talk to the counties, the one thing they say, the members of the community, even if they don't have a physician, they talk about the need for mental health services. And we see that everywhere we go. We came up with the free clinic as an answer to that, but Children's has jumped into that, and they've hired one of the leading child psychiatrists in the country who's been guiding our project here, and we're going into public schools and private schools. We started in Jefferson and Washington counties to screen children for mental wellness, and we don't leave the child unattended. We work closely with the school counselors. We develop an emergency plan, but our goal is to screen every child in every school in rural Georgia, and that's lofty, but I think we can do it. And so we're adding 2 more counties this year. And to that, it's quite intensive, but we intend to fully get that work done. One thing Children's came up with, which I thought was pretty cool, is they offered us 10 full rides for 10 young people who would be general pediatricians and live and work in a rural community every year for 10 years. That's 100 pediatricians coming out of Mercer who will live and work in rural communities. We selected our first 10, and they allowed us to go back, and we started with the senior class, and we had 2 seniors, one matched in pediatrics at the University of Florida, the other matched at Morehouse. We have some juniors, some second years, and some first years, but we just opened that up again, and we'll have 10 more this year. That means in 10 years, we'll have 100 pediatricians who practice in rural counties across our state, and that is amazing, and that will be transformative for our state. A few months back, they called and said, we have, the School of Medicine houses a marriage and family therapy program, and they offered scholarships for 10 marriage and family therapists to live and work in those rural communities with those physicians. And you can imagine, and they asked that these scholarship recipients agree to see children. Many therapists won't see children. So we're going to give them additional training in children, and we're also going to give them a certificate in autism. Because if you live in rural Georgia, you know there is no care for early evaluation. Not directly related to this project, but Children's connected us to the Marcus Autism Center. And Dr. Klin came down to Mercer, and we had a great day with him. He runs the center. He wanted to know more about rural Georgia, and we wanted him to know more about rural Georgia. But he's developed a device that screens children very young, and the previous testing could take 10 hours or about 10 hours in testing, and you couldn't get an appointment if you tried. This device scans children in 10 minutes. It's FDA approved, and we're going to do a trial. We're going to start in 1 rural county, possibly 2, to screen children for autism. And then Marcus has agreed to train the caretakers and the parents in how to early intervention that can really decrease the long-term ramifications of autism. And I'll be glad to answer any questions. I think that, truthfully, this effort, and Children's deserves the credit because they're allowing us to use this fund to fund all of this. This costs the rural hospitals not 1 dime. we're funneling that money into these communities to make sure they get what they get, and we're there to help them sustain it. We tell communities when we go in that we aren't going away unless you run us off. And but the fun thing to me is to see the esprit de corps that's developing between these hospitals. And they even came up at this stakeholders meeting the other day, and they're going to audit each other. They're going to have a team that goes in and runs a mock code in one hospital, and the other hospital will evaluate them. And those things make you better. We've instituted some of the protocols that are proven and current from children's in these rural hospitals. We had one hospital in Middle Georgia that had a child that came in with severe DKA, diabetic ketoacidosis, so is type 1 diabetic, that got in real trouble. And instead of transferring the child like they typically would have, they used the children's protocol, treated him by that, and the child was able to go home the next day. And we're going to put a little more of that story in one of our newsletters. But that can happen across rural Georgia. And so we appreciate your support and your interest. The one thing I'd ask, as Glenda did, is that spread the word. We want to be in these hospitals. You know, I've been in rural Georgia a long time, and when people call you up and say, I've got something for you that is free, you go, yeah, right. This is really free, and we're really there to stay. So thank you for your interest.
Thank you, Dr. Sumner and John, for your presentation. And I can truly say from experience and from being an advocate of the work that you're doing in Washington County, Jefferson County, and other rural communities, and we really appreciate it. I always enjoy coming to the Nathan Deal Scholarship Luncheons and seeing all the young people from District 128 that are already enrolled. And I'm sure Chairman Hatchett enjoys seeing kids from Dublin, too.
That's right.
I think Washington County has more than Dublin right now.
Well,
at Mercer.
please don't tell Chairman Hatchett. Though I did call a young man from Dublin last night that got in, and just because Matt was out of town and I wanted to call him.
Chairman Green.
Thank you, Dr. Sumner. We're just so glad you're here. And John, thank you for that presentation as well. How are you getting these pediatricians to come to rural Georgia? We are trying to get nurses. We're trying to, and money was not the problem with us. How are you doing it?
Chairman, it's a complex. You have to understand rural health. There's a science to rural health that often is cliched, and if you listen to language, people look down on rural areas. I don't mean that in a bad way. They don't mean to. They think they're saying, but we don't allow that language to happen at Mercer. We have great respect for these communities, and we honor them. The most important factor is you will not get somebody from Buckhead to go to Hayhira. You're not going to. So the average percentage of rural students in MD programs across this state that grew up rural is 4.3%. Last night after the admissions committee, we're 54% rural, and we don't accept anything but Georgians, and I get ugly letters from Texas. So, we only accept Georgians. 70% of our entering class typically is outside of metropolitan Atlanta. And so if you come into Mercer, even if you fall off the wagon and end up in Atlanta, you're going to understand rural health, and you're going to have respect for the doctors that are there. So these young people, we also focus on clinical skills. In order to be a rural physician, I'm an internist. You have to have a broad range of skills, because there are a lot of things that walk in your office that you will never see in an office in Atlanta. I say this a lot, but I'm one of the few internists that can take out a treble hook as well as anybody. I delivered 14 babies, not because I wanted to, but I was the only doctor in the county. And the police and sheriff in Johnson County didn't care what kind of doctor I was. I was better than them, so they brought the women to you. So it's not that I want to do that, but you have to have that resiliency, and you have to have a broad range of skills. So our students go through an aggressive clinical skills course where we really focus on communication, knowing your limitations, knowing how to examine a patient, knowing how to get the right appropriate studies. And so they leave with good clinical skills and can learn from others. But we also stay in touch. And what we think is one of the strengths of having telehealth is, second, if you're the only doctor in the county, and I have been, it's hard. you want somebody to give you an opinion about it, particularly when you're young. You can't be a bad doctor in a small town. Everybody knows it. So you truly want somebody to look at it. I went and practiced with my brother and father, and I've told this story a number of times, but one of the first things I saw was a rash. Now, I could take care of a heart attack and diabetic ketoacidosis and sepsis. We did that every day. You didn't see many rashes in an ICU in a tertiary care hospital. So I called my brother down there. I said, I don't have a clue what this is. And he walked in the room with me and said, Dr. Sumner, you're absolutely right. And I agree with your treatment choice of so-and-so. And the patient thought I was a genius. I didn't have a clue what I was doing. But I had a partner that would, give me some answers, and I could ask dumb questions to. So you can do that through telehealth. And I think that this allows those pediatricians to be able to really expand their scope and take care of these children. But taking care of children sets a tone for the family, and it matters. So.
Thank you. Chair recognizes Representative Al Williams.
Thank you, Dr. Sumner. I told you this morning what all I'd heard about you before meeting you some years ago. But I heard you, and do you have a med school, sub-school down at Memorial in Savannah?
Yes, sir. Mercer, the home campus is Macon. We have four-year campus. We've been in Savannah for 30 years.
For some time.
We just don't tell people loud
I
enough.
know, it's been quiet, but I'm trying to break in on those students need some from District 168 for you to be complete and comprehensive.
Is that Savannah?
No, that's Liberty County, much greater than Savannah. Savannah's a bedroom community of Midway.
Liberty. We have students in Liberty County.
Okay.
You just got to ask them where they went to medical school.
I need to get a list because I haven't seen it. We're one of the few rural counties that have a pediatrician and have had for quite some time, level 5. So we're blessed there, but we certainly need some more help, and I'm going to get some more information from you.
I'll be glad to help you any way I can.
All right, thank you.
Chair recognizes Chairman Penny House.
Thank you, Dr. Sumner, for the care that you've always shown rural health. I've got my family connection in Berrien County called me last week, and they are setting up a support group for autism for the parents because it's a 2-year wait to have a child tested.
Absolutely.
And you talked about there's a new screen test. How do you go about getting that in your county?
We'll put you on that list.
Right, thank you.
I can tell you that I think that this opportunity with the right intervention is going to. Dr. Clint is a world-renowned expert.
Yeah.
You can change outcomes. You can change quality of life, and yet we can't get children screened.
No, we
which
can't
is
get
so
them
wrong. And the parents and the caregivers and wherever the child is can intervene early and make a huge difference.
Yeah. And the parents want to. We've got a group of parents
But-
that are desperate.
I have ways you can help, and we can talk about it offline.
Okay, thank
but
you.
we picked a county in middle Georgia, not Washington, right off. I promise, Mac.
This is South.
But we're working in Berrien County. We have a lot of things going on in Berrien County, so it would be an easy
All right, thank you.
thing. So
I'll get with you.
Chair recognizes Chairman Robert Dick.
Thank you, Mr. Chairman, and thank you, Dr. Summer, for being here. And it's nobody I highly respect more about rural health than you. And
Thank you.
this committee has heard a lot of real positive things today and in previous meetings about rural health and some great things going on. Are we getting ahead of the curve? What?
I'm an optimist. I don't give up, but I do think I don't think we're ahead of the curve, but I can see the beginning of it. This initiative is going to transform children's care. We have 10 years. We have 10 years to make a difference. Can you imagine we have 63 counties without a pediatrician? Every student that took this scholarship last year committed to us that they don't mind being the only pediatrician in a county. They'll get it started. And so we can change with that, but you have great people in these rural counties who just need some training. We sent groups to Atlanta, and they were thrilled with the experience. The sense of camaraderie that's grown in these rural hospitals. I was in Washington County the other day, and That's where I spent my life practicing. The first gallbladder surgery in America was done there. But we had fallen on hard times for a few years. And the report we received was that the surgery's coming back. My dad was a surgeon there. He's long gone, but the surgery's coming back to Washington County. They're having to hire anesthesia for surgeons that are leaving cities and want to work in small towns. And so I do believe we're not ahead of the curve, but we're heading up. And I'm hopeful. I really am. And I think that, rural health gets faddish. I mean, people like it and then they forget it. We don't forget it. We don't give up. And so we're still staying at it. So thank you.
Chair recognizes Chairman Darlene Green. Darlene Taylor.
Thank you.
I got it.
Okay, something new. Thank you for what you're doing. We all know there's trouble getting pediatricians. Rural communities are hard. But one of the things that I have noticed over the last probably 20 years, the hospitals have actually lost their pediatric wings or beds. I recently had someone in my district that their child broke their leg, needed to be admitted, and they had to go down to Tallahassee because we didn't have the services there. And I felt like, oh, we do everything. No, we did not have pediatric beds. So that is something, as we're looking at this picture, we need the pediatricians, and as we get them, I'm hoping we can encourage the hospitals, even the small ones, to put those in for treatment of kids. This was an emergency. And again, they had to leave town to go, and I always felt like we're pretty secure, and we really were.
Well, and I think you've got to plant seeds, and we're planting those seeds. I do believe that will come back. I think children, the stress of a family that has to travel way away is really tough, and there's so many. If you get enough pediatricians, think of the things you can prevent.
Exactly.
But also, even if they have to go somewhere for a procedure, they could follow up at home. I agree with you. Some of the hospitals are beginning to do that. Moultrie has a small bit.
They just started that.
They just started, and others have too. But I do think that you have to understand that these regional hospitals, you should try to do it at home or nearby or a regional hospital. And Children's is a tertiary and quaternary center that is world class. And so what they do, nobody else does very often. So it's really important, I think, to protect that ability to serve those children. They get a lot of referrals from across Georgia. What I'm grateful for is their willingness to help those of us in rural, underserved things. And so they deserve the credit. We're just the worker bees, and we appreciate their support.
I appreciate you planting those seeds because it is starting, like you said, Colquitt Regional, and the partnerships are what's going to make it happen. So thank you.
Absolutely. And they're on this year's list. So.
Dr. Summer, thank you for everything you do. And John, thank you too. And Children's Hospital for recognizing the need for rural pediatricians. Thank you.
Before we go to our next presentation, I'd like for all of us to rise in a moment of silent prayer. And Chairman, if you will then take the mic and remember David Ralston and what he meant to this particular group, and that especially on this particular date of his death.
Thank you, Mr. Chairman. As we remember Speaker Ralston and the legacy that he left behind, we honor that legacy by continuing the great work that he envisioned for rural Georgia. We're just so thankful that Speaker Ralston left footprints in the sands of time, and we can honor him with everything on this day. And Lord, we just thank you that we had a chance to know a great man in the state of Georgia who loved Georgia, who loved people, Lord. And because of him, we're here today. And we thank you for the legacy of Speaker David Ralston. In Jesus' name, amen.
Thank you, Mr. Chairman. That was quite appropriate there to say. All right. I think we are now ready for Pam. If you will come on up, it's good to see you, and thank you for coming today.
Yeah, thank you, Mr. Chairman, members of the council. Appreciate the opportunity to be here with you. And I want to say to the presenters earlier, Thank you so much for your presentations. They were very inspiring and also provided for some sobering statistics that around the farmers, was really sobering that Glenda was sharing in the Rural Health Innovation Center presentation. And sadly, we could say that the same statistics or similar apply to nurses and healthcare providers. And so, lots to do, and appreciate the innovative and great work that they're doing around that. So I'm with the Georgia Healthcare Association. Pam Clayton, I support quality advancement, regulatory affairs, and there at the Georgia Healthcare Association, really our mission is about promoting quality for those beneficiaries served in a variety of settings. Just quality of life, quality of care for those that are entrusted to any of our member providers. And within that member profile, we of course support skilled nursing care centers, also known as nursing homes, and assisted living providers, the elderly and disabled case management programs, and also have a variety of member and vendor members that provide ancillary services. I do want to point out that within that 348 skilled nursing facilities that we serve, 144 of those are rural. And so certainly we're interacting with rural communities, rural member providers on a daily basis. Within the nursing homes alone, over 40,000 Georgians are served, and probably about 74% of that population is Medicaid recipients. So I just wanted to kind of provide some perspective around the reach and the touch. And we're struggling like so many across the state of Georgia relative to workforce. And I don't want to belabor that point. That's something that you all are aware of. But it's something that has taken on some new urgency for us, and I'll talk to you a bit more about that in just a minute. But in Georgia, we're thankful to have a burgeoning aging population. That's really a great thing to have, but we're also managing that in the environment of a critically strained workforce. And so how do we ensure that we're providing great quality of care, services that enhance quality of life amongst this really critically strained workforce environment? And it's a national problem within the healthcare setting. And we're almost 246,000 workers short as compared to where we were pre-pandemic in our sector. And that certainly holds true in Georgia as well. Within our long-term care and residential service provider communities, that's assisted living and nursing home, we're almost 6,000 employees behind where we were pre-pandemic. So yeah, you hear that, we're coming back and the workforce is kind of building back up. And I'm grateful for every setting in which that's occurring. But we're not there yet. We're not there yet. And so we're continuing to focus on recovery. But as you can see from this slide, we're still significantly below where we were pre-pandemic as compared to other provider types across the healthcare continuum. Again, we want everyone to succeed. A healthy health delivery system raises everyone up. And but it is important to know that in our particular sector, we're significantly behind where we were pre-pandemic. And again, when you think about, someone asked about, are we ahead of the curve? Where do we need to be relative to the population trends that are occurring nationally, but also occurring in Georgia? And we have got to be able to meet the demands of the aging population. And really, we have both an aging population, but an aging workforce, and really an inadequate pool from which to draw. So it's really kind of a troubling combination if you think about it. And while I'm not an economist, and we did share some information that'll provide context around this information here, it's important to understand the economic impact of skilled nursing centers and residential service providers in the local rural communities. Oftentimes, the local nursing home is the largest employer in that county. They are very much a driving force in that economic activity within the rural communities. And so therefore, we have to think about, when we think about the health of rural communities, and I don't mean just the physical health, but the overall economic health and all holistically speaking, really looking to these nursing centers, the assisted living providers, what do we need to be doing to support and help to ensure that they remain viable and healthy so that they can continue to provide economic viability within the communities, as well as those very important healthcare services that they provide. So again, I think we sent some collateral information ahead for you all to have for your reference to give even more context. So I wanted to provide a little bit of that background about the current landscape in Georgia and where we are relative to workforce and thinking about the numbers of long-term and post-acute care providers in Georgia, and need to talk to you about a looming threat that we're dealing with presently. I was in Washington a couple of weeks ago, meeting with the Georgia's congressional delegation, talking about this. And you might think that's at the federal level. We're talking state, but it really is. This is a critical piece of a proposal that has been proposed by the Biden-Harris administration related to minimum staffing standards for long-term care facilities and Medicaid institutional payment transparency reporting. And the public comment period ended November the 6th. And there were over 40,000 comments around this rule, which means CMS will have to comb through those comments before that they can move forward. So we think we might have a little bit of time as they move through that process, but still yet it's imperative that you understand what is proposed. And remember that I told you we're already 6,000 employees behind approximately where we were pre-pandemic. Well, they have proposed a rule that would set a minimum number of hours of resident care for RNs and certified nursing assistants for each resident. And an RN would be required to be on site 24 hours a day, 7 days a week. And within this proposal, so perhaps you might say, well, that sounds like a good idea. What would be wrong with being prescriptive around some minimum standards? Well, it doesn't account for licensed practical nurses. And if you all are familiar with the hour setting, there are thousands of dedicated LPNs that provide care within nursing homes and today, and it doesn't even account for those individuals. It's prescribing specific numbers of hours that must be provided only by a CNA or an RN. And it also doesn't account for activity professionals and social workers and therapists and all of those really key individuals that help to provide a quality, comprehensive plan of care. And so, again, even if we thought that it sounded good in theory, the ground truth is simply that Georgia nursing centers would need, remember the number I've already provided, around the 6,000 number, would need to hire an additional 3,600 full-time employees to meet this requirement. Okay, the workforce is simply not there as specified. It's kind of this one size fits all proposal as compared to some of the things that they were outlining around meeting the local communities where they are and providing services that they need in that local community. And so they're saying you have to have RN only, you have to have CNAs in this number of hours. We're not looking and considering LPNs, and it's not allowing for those service models where in some cases, behavioral health may be the primary service that they're seeking to provide. And that may be inclusive of a staffing model that would be higher with social workers or counselors or activity professionals versus a higher nursing complement that might be expedient in a setting where that you had ventilator care or managing, really clinically complex patients. So here's something that really we need to pay attention to. The proposed mandate would cost Georgia nursing centers approximately $187 million a year. In Georgia alone, $187 million a year with no proposed funding to support this. Just the mandate, no proposed funding to support it. And presently, less than 1% of Georgia nursing centers in the state meet all three of the criteria that's proposed in the mandate around the RN requirement, the CNA requirement, and the 24/7 RN presence. Not provided through, can't be provided at this time through telehealth, remote support, simply physically present 24/7. And of course, you were hearing earlier about health disparities and who were more at risk and how you could kind of overlay that COVID deaths rates with those health disparities. Well, so we see that centers that have a higher prevalence of Medicaid recipients are less apt to meet the criteria proposed in the mandate. And so the National Council of the State Boards of Nursing 2023 environmental scan found that Georgia has some of the lowest ratios of employed RNs per population in the country. So there are fewer than 750 employed RNs per 100,000 people. So that's saying, go hire more RNs, but this is our operating reality. This is where we really are. And my big concern is even if the funding was there, you can't find the staff, and will folks kind of pivot to this warm body? I'm going to hire somebody to serve as CNA because I've got to do that to be compliant, and what will have happen to quality of care? And then the other piece of that is we're already within the skilled nursing centers, we're utilizing 220% more agency staff presently than we did in Q4 2019. And if and that can wreak havoc on your quality of care, your consistency in caregiving, simply because those agency staff, while they may be great nurses, great caregivers, they aren't familiar with the residents plan of care, the systems within the facility. And so to increase the reliance on agency staff more so than what we already are, and again 220% more than Q4 2019, it's deeply concerning to me. So it feels like we're chasing a number versus really promoting building a service model that responds to the local community and the service model that is needed therein. So we're grateful. Governor Kemp, along with several other governors, wrote a letter to President Biden opposing this. Many of your colleagues have spoken out, and we're grateful for that. And we need you to continue to give voice to how unrealistic and dangerous this proposal is if it moves forward as written. And so, I don't want to be an alarmist. I often say I've been in this profession for 25 years, and I say sometimes we can be like the sky is falling and be a little bit reactive. We function in a highly regulated environment, and I caution folks against that. The sky can't always be falling, but this feels like one of those times where if this moves forward as written, we really do have a challenge. So thank you all for the great work that you do and the support that you've provided in the past. Retention is certainly important, and that's incumbent upon us to look at how we can continue to enhance recruitment and retention, but pipeline development is critical. And House Bill 497 that was passed last session was written to allow us to expand certified nursing assistant and certified medication aid workforce, which is critically needed, as I've just said. And so we're awaiting the rules from DCH that should be put forward as a result of that legislation. So we think that will be very, very helpful. So thank you for that. We continue to, again, need to focus around those seamless pathways. We've got to reach folks early, and we've got to identify those individuals that, honestly have a heart for caregiving and that they show aptitude and interest. And so within the college and career academies, there was the Joint Study Committee on Dual Enrollment for Highly Skilled Talent at Younger Ages, and that was co-chaired with Representative Matt Dubnick, and I think that report is out. And so it provides for meaningful insight and recommendations, and certainly we are supportive of permanent support to allow all students to participate in dual enrollment to access HOPE career grant funds for eligible CTAE courses, irrespective of whether that student has reached the maximum credit hour cap. So we really appreciate your support around that. Of course, policy and funding support is always necessary. And, when you look at attraction of the right folks to serve in this setting, and just like we want children to have great care, we want our elders and those folks, when it comes time that they need those services, we want them to be able to avail those services in a quality setting. And so we want to attract top talent. We want the best and the brightest. And that involves being able to to offer a really robust employment opportunity. And so for the residents, the patients that we serve, and the employees, continuing to focus on infrastructure and modernization of our physical plants and settings, I think is really important. And of course, continuing to provide positive public support around the great work that has occurred out there and continues to occur. It's a difficult decision when someone needs care in a skilled nursing center. Oftentimes folks maybe would like to avoid that decision, but it's necessary at times, and you want it to be there again when you need it. And so we need to really invest in this service offering across the healthcare continuum, and we need to invest in those individuals that again show aptitude and interest. And so just in closing on that proposed mandate, recognizing the upstream, downstream impact that it will have on the health delivery system in Georgia if it moves forward. We already, because of workforce issues, maybe in some cases are limiting admissions. Maybe when the hospital calls and needs to refer someone to us, we're not able to admit because of workforce issues, and we want to ensure that we can meet the needs of those individuals. And so, the Georgia Hospital Association co-authored a letter with our president to CMS. So across the board, we're grateful for the support, but we need to continue to advocate that this just simply can't go forward as proposed. And again, grateful for everything you do to continue to invest in workforce development in the healthcare space. All right. Thank you so much.
Questions?
Sure.
Chair recognizes Representative Al Williams.
Thank you for your presentation. Thank you, Mr. Chairman. A couple of questions. First, I empathize, but I also need to know, before the pandemic, you had staffing problems, and many nursing homes had horrendous and horrible horror stories and I got personally involved in one that took forever to clear up. The place was literally falling down, but nothing was done. And I want to know where the association is on self-policing, because what I've found is that while it is very popular to complain about federal intervention, usually comes after years of trying to get somebody to do something locally. I know it's difficult what we're saying, but what is the association doing? Because many of these facilities are privately owned and we can't get involved in the funding. So what are you doing to improve the situation and be able to make a case that we're better now than we were yesterday when we say, hey, feds, you don't need to come in. Look where we were and look where we are. Can you do that?
Yeah, thank you for that. And, always quality of care and quality of service is the standard and the expectation. And I would never want to say that there are times that, such as what you've outlined, where that we failed to meet expectations. And when that's the case, that needs to be identified. You mentioned self-policing. And while I don't have the number in front of me, I can tell you that we have done a tremendous amount of education and training on self-reporting to the state survey agency. There's some concrete requirements around that. And we see, based upon the trend lines, that for the numbers of self-reports, and DCH, I think, is in the House and could support, that trend line has consistently moved upward. And so a self-reported incident might involve if someone alleged that there was neglect or care delivery was not provided as expected or as per the care plan. So even if it doesn't have to be founded, it just has to be an allegation. So that reporting has just consistently trended upward over the past several years, and those numbers are verifiable. So transparency is so important. We have not arrived in terms of, that quality of care. I think there are lots of folks out there doing great things every day, providing really good care, but sometimes we fall short, and any instance of that is never okay. And so we have to continue to strive to provide great quality of care, ensure that folks understand what the requirements are, educate around that, and again, provide the oversight and support to ensure that it's occurring as intended. And I think that you're right. I often talk about the fact that our fingerprints were, to some degree, were on retention pre-pandemic, right? We had some workforce challenges then. So really promoting and offering support around, looking internally to say, what can we do? We talk about a workforce shortage, but if there are high numbers of folks going through our centers that are turning over, why is that? Always got to focus on the quality of hire and have really great hiring practices, but what are you doing to nurture and support them when they come on board? And so those efforts are ongoing in a very robust way, but every single person and every incident of care that doesn't meet expectation or standard, it's not okay. Not okay.
Chair recognizes Chair Darlene Taylor.
Thank you, Mr. Chairman. I appreciate all the services that you do, and we have several facilities in my area, and they do work. If there's something out of COVID, I think it shined a light on a lot of the needs that we already had. It's almost a mission working with it. But I am concerned about the mandate, and do we have a date when that mandate is kicking in, when it's going to start?
So public comment period ended November the 6th, and so from that, it is incumbent and required by CMS to review every public comment before they can move forward with a proposed final rule. So because of the vast number of comments that were made, we think that, that could be 6 months or longer before we get the next phase. But this is so significant at Georgia's level and at a national level that, we will continue to to fight this at every possible level, even, you know, from a legal standpoint, because we think that it really far exceeds CMS's appropriate reach. It's a real, you know, overreach to be prescriptive around what that looks like. So, you know, it's going to take some time. We don't know the exact timeline, but over 40,000 comments that have to be addressed.
Okay. Thank you for what you do and
Thank
your
you.
members.
Thank
Appreciate
you.
it.
Recognize Representative Al Williams.
Just want to know, please, how many nursing homes are there in Georgia?
Yeah, so we've got about 360 in Georgia. Almost all of those are members of the Georgia Healthcare Association. As I think I shared on slide 2, 348 are members of the Skilled Nursing Center. So yes,
Thank you.
you're welcome.
Thank you so much,
Thank
Pam,
you.
for the presentation.
Thank you.
And everything that you've given us today.
Thank you.
We are kind of ahead of time. We can take about a 5-minute break. Be back around 3.
All righty now.
coming back to your seat so we can get started. Our presentation is given this afternoon from the Georgia Commission on Equal Opportunity from Ms. Alana. Alana Lane Cross.
Thank you, Mr. Chairman. Good afternoon, Chairman Green, Chairman Jackson, and members of the council. It is a pleasure to be here with you all. Today, I'll be presenting on working toward housing access for all. So, to my knowledge, GCEO has not had the pleasure of presenting to the council before. So I just want to take a moment to share more about the agency for those of you who may not be as familiar with us. GCEO was created by the passage of House Bill 1711 in 1978, and our primary purpose is to safeguard Georgians from discrimination in both employment and housing. Our agency consists of two divisions, the Equal Employment Division and the Fair Housing Division. The Fair Housing Division is what I'm going to focus on primarily today, but the Equal Employment Division, we have the privilege of enforcing the Georgia Fair Employment Practices Act. And the Georgia Fair Housing Law is what the Fair Housing Division enforces, and it safeguards individuals from discrimination in the sale of a dwelling, the financing of a dwelling, as well as the rental of a dwelling. On the basis of 7 protected classes, there's race, color, national origin, religion, sex, which includes sexual orientation, gender identity, and then there's also familial status and disability. And our housing division has a memorandum of understanding with HUD, and if an individual files a complaint with our office, the complaint is considered dual filed on both the federal and state level. All right, so our office has many layers to it. We strive to ensure equal treatment of all Georgians by eliminating systemic discrimination through enforcement of the Georgia Fair Employment Practices Act and the Georgia Fair Housing Law. Because often when you think about discrimination, it can sometimes take on subtle or hard to identify forms, even though the policy that may facilitate the discrimination occurs openly and in plain sight. And that's why our office is an avenue by which citizens can file their allegations of discrimination. And it is our duty to ensure equal treatment of all Georgians by fostering a more open and receptive environment to conduct business, to live, and to work. And we are truly dedicated to promoting fair and inclusive workplaces and communities, because safe and affordable homes, free of discrimination, should be equally accessible, which speaks to the importance of the Georgia Fair Housing Law that values equal access to housing in all communities. And this is what GCO envisions for the state, and that is prominent among our core values and our principles that underlie our work and the great work that each of you do as well. So to really understand the barriers to fair housing, it's important to understand the basic principles of fair housing. The general public tends to associate fair housing with affordable housing. However, it couldn't be more different. Most think fair housing is a socioeconomic issue or an income issue. However, it couldn't be more different. Affordable housing is housing that is deemed affordable by a local affordability index, and it consumes no more than 30% of a household's income. However, fair housing is simply the right to choose wherever you want to live, free of discrimination, and of course you should be able to afford it, but be able to enjoy your dwelling free of unequal treatment. And because housing is more than just where we live and how it affects other aspects of our lives, it's even more critical that no one is unfairly denied housing, especially in rural areas where the population's livelihood is already significantly impacted. And so quality housing is a stabilizer that links individuals to other opportunities, such as access to health care, access to great education in schools, access to employment, transportation, food, municipal services, and other community amenities. And in closing here, quality housing is truly a stabilizer and is undeniably the foundation to a greater quality of life. Oh, I'm sorry for that slide. No, we have a lot more to go. So here are some of the barriers to fair housing that we've identified in rural parts of the state. For the sake of time, I won't provide additional context for each of the barriers, especially if they're self-explanatory. But there's a lack of fair housing knowledge among members of the public and various entities involved in the business of real estate. There's difficulty securing suitable and accessible housing for residents with disabilities and also those with language barriers. There's a negative stigma and stereotypes that's associated with civil rights due to a lack of understanding and misconceptions. And so specifically, even the term discrimination can sometimes elicit fears or bring about uncomfortableness with definitions of unfair or unethical occurrences, because to some, civil rights is a race issue. However, housing affects everyone. Every single person in this room fits into one of the protected classes. So for example, raise your hand if you have children. Yay. All right, raise your hand if you have a family member with a disability or maybe you have a disability. Raise your hand if you fit into a gender category, so you're male, female, or non-binary. So the purpose of this activity was really just to show that fair housing truly encompasses everyone. Every single person in this room raised our hands at some point. And so we have to remove that negative stigma when it comes to discrimination, because it perpetuates a negative stigma and it gets in the way of fair housing choice. There's also a lack of affordability in housing options. And another barrier is non-compliance with existing fair housing laws and regulations. Often in rural areas, there's a mentality of it's my property, and individuals believe that no one can tell them what to do with their real estate. And that implies to even the law. There's also limited fair housing infrastructure as well. That's another one. And while we serve as the Fair Housing Enforcement Agency for the entire state, our office is only located in Atlanta. So we're not like other agencies with field offices throughout the state. And so we do not have a direct presence in a lot of areas, especially rural areas. For several years, we did have a field office in Savannah that serviced those surrounding areas, but it was closed due to budgetary constraints in 2007. However, and we were forced to close. So we noticed that in 2007, we were unable to receive any complaints in that area, not because they come foul, but simply because they missed our presence in that area of Savannah and the surrounding areas. And as a result, rural communities are further removed from our agency. And lastly, there is a fear of retaliation. By definition, rural areas have small, isolated populations, resulting in close-knit communities with limited resources. And there's a fear of retaliation by others in small communities from other rural residents. And so it keeps them from filing a fair housing complaint with our office. And also Latina victims, they seldom file a complaint with our office. And they're obviously concerned about government retaliation, even if they have a legal status in the United States. And regardless of how much we try to assure them that filing a complaint with our office would not hinder or prevent them from having their residency status, they're still reluctant to file a complaint with our office. So next, let's talk about the data that we're seeing. We have our 2022 data available here for you all. And so in 2022, we received a total of 1,655 housing-related inquiries from citizens across the state. Out of those inquiries, 121 matriculated into official fair housing complaints. Out of the 121 complaints filed with our office, 18 complaints originated from rural areas of the state. And GCO received the highest number of complaints from Habersham, followed by Bleckley and Bryan counties. Because of our partnership with HUD, we also have access to their database as well. And so HUD received the most complaints from Liberty, followed by Bryan and Habersham. Sorry about that. And these are the top 3 protected classes that are filed with our office. For the past several years, disability and race are the most frequently filed bases with our office, disability being the number 1. And please direct your attention to the statewide chart. From your view, it will be on your right. You'll see that 51% of our cases were related to disability, followed by race at 36% and national origin at 9%. And out of the 18 complaints that were filed with rural Georgia counties, if you look to the left, you will see those percentages. And disability, again, was the top protected class at 39%, followed by race at 33%, and sex and sexual orientation, gender identity at 17%. And as you can see here, the top protected classes in rural counties pretty much remain the same, as well as those complaints filed on the state level, with the exception of that 3rd protected class, which was sex and gender, followed by, with statewide, it was more national origin. And so disability is our most frequently filed basis on the federal level as well. And I think it's because the definition of disability has grown significantly under the Americans with Disabilities Act. Over the years, we now have conditions such as asthma that are considered a disability. Mental illness has also increased as a result of the COVID pandemic. And so there's also a lack of accessible housing throughout the state. And along with children, our disabled population is one of our most vulnerable populations, and they deserve to have accessible homes that they can enjoy just like everyone else. And disability-based complaints often involve apartment buildings that are not accessible to people, assistance animals, whether it's a service animal or an emotional support animal for an individual who may be suffering from mental illness, are also a source of conflict. And we have found that some housing providers have a no pet policy, and they view those assistance animals as pets, when under the law, they're not considered to be pets. There's many apartment owners who make direct comments that are discriminatory to individuals with disabilities, and they deny their accommodations or their modifications. And then we're also seeing that many builders and developers continue to build accessible apartments that are not accessible and that violate accessible guidelines. So let's take a look at the top 3 issues that are filed. The issues are that subject matter that are covered under the law, and it can involve refusal to rent, discriminatory terms and conditions, denial of a reasonable accommodation or modification. So here, this is our 2022 data, and the top issue that is consistently filed with our office, both statewide and in rural counties, is offering different terms and conditions at 72%. An example of that would be, say for instance, an individual goes into a bank and applies for a mortgage loan, but they are offered different terms and conditions to acquire that loan via whatever the different terms and conditions are because of their disability. The second and third top issues differ when comparing issues statewide versus in rural areas. Statewide, you can see here that the second top issue is making housing unavailable or denying housing at 42%. An example of that would be a home being lost due to a lien, eviction, or a non-renewal of a lease. And lastly, denial of a reasonable accommodation because of someone's disability is the 39% issue we're seeing statewide. And then second and third top issues from a rural perspective are discriminatory statements at 44%. And we're seeing an increase in discriminatory statements over the past few years. I think it's because individuals have just gotten really comfortable with making those overt, blatant discriminatory statements, especially when it comes to people with disabilities. And third, in rural counties, we're seeing refusal to rent at 28%. Also, given the prevalence of disability complaints in rural areas, it is somewhat a surprise that a denial of a reasonable accommodation only represented 22% of the cases found in rural counties. So I want to take a moment to share a few cases with you all so you can get an idea of the types of cases that we receive in our office. The case first I'm going to share about is Holton v. City of Dallas Housing Authority. This case involved a female with a physical disability. She was a double amputee, and they refused and denied her reasonable accommodation to move to an accessible unit. She then asked them if she could have a ramp constructed to her apartment unit, and unfortunately, they denied that modification as well. In this particular case, the investigation revealed that the delay of the modification caused the complainant to crawl down the steps to access her mailbox. Unfortunately, she didn't have family in the area to assist her, and so in order to access her mailbox, she had to crawl down the stairs. We conduct on-site visits where we actually go out to the properties, and this was a very egregious case because unfortunately we were able to witness those injuries that she sustained from crawling down the steps to access her mailbox. So in this particular case, it resulted in a conciliation, and that's an alternative dispute resolution that our office offers to parties to resolve issues. And she was able to get that accessible unit that she needed. The other case involved Beamer versus Atlanta Fine Homes, and it involved a female mother of 3, and she and her children were denied the opportunity to rent a 5-bedroom, 4-bath home in Milton, Georgia, because they informed her that the home was very well maintained and she had too many children, and they felt she would destroy the home because of her children. And in this particular case, the complainant actually earned 7 figures. Her 7 figures exceeded the qualifications to rent the home. She also could have purchased the home, but she wanted to live in the community first to determine whether she liked the community. But unfortunately, she couldn't because they denied her and her children the ability to rent this home despite her 7-figure salary and her ability to meet the minimum qualifications. The next 2 cases are cases that originated in rural counties, specifically Baldwin and Bryan. And these cases also are based on discrimination with families with children. The parties in the first case wanted to have their conciliation agreement remain confidential, so that's why the name is not shown. But it involved a property management company who enforced overly restrictive rules against families with children. They issued a mass text that informed the community that children under the age of 16 had to be supervised by an adult at all times, or words to that effect. And so the investigation revealed with this case that the statement made against children was overly restrictive and discriminatory. A rule asserting that a requirement of constant adult supervision for teenagers who are more than capable of supervising themselves. For example, you have some teenagers who babysit their younger siblings, some teenagers assist an ailing parent or elderly parent. And so it was no need for them to have constant supervision. And that creates oppressiveness, unnecessary and unfairly burdensome issues for families living in that community. And the Georgia Fair Housing Law protects families and the rights of children, so they can enjoy the amenities just like everyone else does. And the last case I want to share about is the Powell versus Karen McGahee. This involved a female mother of 2 who saw an advertisement on Facebook, and she was informed by the owner in writing that in order to rent the apartment, she needed to be a student and that she could not have her children live there because the walls were too thin and they didn't want to accept children. So both of these particular cases resulted in a monetary relief via our conciliation process. All right, so now let's talk about the most important part, solutions. How do we fix and resolve these issues that are related to barriers affecting fair housing choice? And our primary mission is to work towards solutions to prevent systemic discrimination and barriers to fair housing by eradicating it. To address fair housing issues, we've identified 3 areas. Solutions would be enforcement, education and outreach, and initiatives. So we have the privilege of enforcing the Georgia Fair Housing Law and holding housing entities accountable if they commit a discriminatory housing practice. But for the sake of time, I will not go into our entire investigative process. However, it begins with intake and it ends with rendering a determination of no reasonable cause, meaning we did not find any elements of discrimination, or reasonable cause, meaning we did find elements of discrimination. We have all the tools made available to us by the Georgia Civil Practices Act to conduct and facilitate very thorough investigations. And in terms of education and outreach, we are statutorily required to conduct education and outreach. And we believe that it is an effective way to remove barriers to fair housing. For rural areas, we rely on education, outreach, cultural sensitivity, and partnerships to address issues and ensure public awareness of individual rights and protections. If residents are not aware of their rights, when they are unlikely to know that they've been discriminated against, and so they may not take any action at all. And since our agency does not have a direct presence in rural areas, that may contribute a lack of knowledge and understanding of fair housing rights in those communities. Evidence suggests that discrimination and limited fair housing knowledge does create unequal housing opportunities in rural communities. This lack of information also has an impact on housing providers and entities involved in the business of real estate, some of whom may be engaged in discriminatory practices and may not be aware. They simply just don't have the education or the knowledge, and most people want to do the right thing. And these are our penalties and fines that we have to help further our enforcement if we render a determination of reasonable cause. A respondent could incur penalties and fines ranging from punitive damages, a civil penalty paid to the state ranging from $50,000 to $100,000 to vindicate the public interest, an attorney's fees, court costs, and also fines ranging from $10,000 to $50,000. And that truly depends on whether the respondent has been found guilty before within the last 5 to 7 years. And these are our 2023 Fair Housing Initiatives. This is our last solution to help remove those barriers. We created the following initiatives around our education and outreach efforts for our small businesses. We assist small businesses in the housing industry by providing 2 free technical trainings each year on fair housing laws. We want to expand their awareness about the rights and obligations under the law because many housing owners receive complaints filed against them, and it can range from landlords, property management companies, brokers, insurers, appraisers, advertisement companies. And we found that sometimes a housing provider's actions are simply because they just lack awareness. And if they're found guilty of a discriminatory housing practice, it can sometimes be very costly for them, and they can endure very costly litigation. So we want to ensure that we're assisting small businesses in the business of real estate to aid them in their efforts to continue integrating communities and to decrease the vulnerability of small businesses from receiving multiple complaints and costly litigation. And then lastly, connecting with rural Georgia. We want to conduct 2 free technical trainings to rural areas with economic challenges and lessening populations. GCO has a fair housing training service that we provide to local governments in rural Georgia that lack the resources to adequately train their employees on state and fair housing laws. And our program will aid those local governments and their constituents by providing them with the tools and resources needed to seek and receive federal funding in their efforts to expand economic opportunities, provide affordable housing, and improve living environments for rural Georgia families. And aside from prohibiting discrimination, the Fair Housing Act requires recipients of HUD funds, including states, local governments, and PHAs, public housing authorities, to analyze their fair housing issues in their communities and larger regions in a planning process that we call assessments of fair housing. The Affirmatively Furthering Fair Housing Rule requires HUD funding recipients to use assessment fair housing planning processes to formulate meaningful goals to overcome the ongoing discrimination, disinvestment, and denial of opportunities for individuals in communities of color, persons with disabilities, and other protected classes. And we assist rural Georgia local governments with this initiative by providing fair housing training and complaint data free of charge. And this obligation means that jurisdictions must take meaningful actions to address significant disparities in housing needs and in access to opportunity. So in other words, fair housing is not just housing. It encompasses all of a jurisdiction's housing and community development activities, ranging from where new housing is located to the adequacy of infrastructure. State and local governments must include fair housing information in their HUD consolidated plans if they receive grants from major HUD programs. And this concludes my presentation. I look forward to answering any questions you may have.
4 questions that we're going to squeeze in about 5 minutes. Chair recognizes Representative Al Williams. Okay. Representative Al Williams.
2 quick questions. They're gonna be back to back quick. How many people you got working?
Great question. You're not going to believe it. We have 16 full-time staff working for both divisions. So in the housing division, we have 10, and in the employment division, we have 3. And we have 5 interns that work and are split between both divisions.
No, I don't believe it. Because if you live in Camden County, you got a long drive to Atlanta.
We do.
Yeah, you about as rare as good golf is anymore. Thank you.
Chair recognizes Chair Penny Houston.
One thing I wanted to ask you about, you came with a chart saying you'd had 18, was it 18 total complaints or 18 people that you find?
Oh, that we find?
You know, you had a thing with the counties in rural Georgia.
Oh, those.
And one of my counties was Cook County, and you had a 1 by, and it totaled up to 18.
Yes.
Were those 18 that you found guilty?
No, that was 18 that originated from those counties, and only 1 originated from Cook.
I know. So in rural Georgia, you only had 18 that originated from rural counties?
We did.
Well, I don't believe in discrimination of any kind, but how does that compare with the rest of the state?
We had more from the rest of the state because we had a total of.
So rural Georgia is not as bad as you make it think out. It make it think out because number on sex, when you do the percentage wise, you had only 6 people report on sex. On race discrimination, you had 5.9 people, and on disability, 7 people all over rural Georgia even reported. I mean, that is not.
So
we're
didn't
nicer
have.
in rural Georgia than you think. I don't believe. I wish we hadn't had anybody that had a complaint.
So we had
but that's not many.
17% file in terms of sex and gender in rural Georgia.
I didn't hear you.
17% for sex and gender, 39% disability, and
I wrote it down.
33%.
I did the percentage one.
Yes.
The percentages look bad, but when you can put those percentages
Absolutely.
up with 18 people, it's not that many.
I agree. And I think it's because there are some barriers there. We have to get out more and conduct more education and outreach in rural areas so they can know that we actually exist. And it's beneficial for both parties. It's beneficial for individuals who may not know their rights. And it's also beneficial for housing entities and housing providers so that they can prevent having a complaint filed against them.
But we're a lot nicer than it sounds like.
I agree.
Golf only got 1 station. We don't sell much gas either.
Chair recognizes Chair Steve Tarvin.
Oh, thank you. You may have answered this. I'll go quickly. It's a little 3-part question. The 4 cases you, were they all litigated those already? Those 4 you listed or?
Yes, all 4 of those cases actually resulted in a conciliation process. So that's an alternative dispute process that we utilize in our office. And we did not go cause on those cases because the parties wanted to just work together and resolve the matter.
But they solved them in favor of the renter or the person that was renting the house. Is that correct?
Yes, so they work together with the individual who rents the house and themselves and our agency, and we work to resolve it via conciliation agreement. And we monitor those agreements anywhere from 1 to 3 years.
I guess the first 2 I could, the last 2 about the thin walls and the 16 and under had to have supervision. did they make those rules after the people inquired about renting it, or is that why those were discriminatory? Or if that was a sitting rule already, were those rules made after the person applied to rent, or do you know?
I'm not sure if they had them on record anywhere written, but they're discriminatory based on the law. So an individual can't have any type of overly restrictive rules, especially when it comes to disabilities or children with families or individuals based on race or anything like that.
And again, of course, the part that disturbs me is if it were thin walls and it was a noise restriction with small children, and it was a rule that was written and already there, I wouldn't understand why that would be discriminatory. But that's for another discussion. I just want to clear that up in my mind. Thank you.
Okay, just to answer your question, you can't deny individuals housing because they have children, whether the walls are thin or not. And so that's where the discrimination came in. And it's up to them to fix that issue in terms of, repairing the walls so that we can ensure that our children have suitable, accessible housing to live in.
Thank you so much.
You're welcome.
Thank you. Chair recognizes Chair Clay Purple.
Mr. Chairman. Affordable housing is super important in the state. It's one of the things that's brought up all the time. We need additional housing. We need affordable housing. We need affordable housing. One of the things that you mentioned, or I could have written it down wrong, but one of the primary areas that people are not in compliance with the Georgia Fair Housing Law has to do with disability.
Mm-hmm.
And you said that the definition of disability has continued to expand.
It has.
So if I happen to be an owner of a house that happens to be HUD eligible, and I don't want dogs to, I don't know, we probably got more dog people here than cat people. So I don't want dogs in the house because I know what it's going to do to my house over time. That's just what happens. But the definition of disability has changed to this dog that was a pet now is called a service animal or a companion animal or something. Mm-hmm. And I can't keep that dog out of my house because the definition has changed. My problem is if I have the right supposition that affordable housing is important, if we continue adding to restrictions for people to make their homes, their real estate, their property rentable, HUD eligible, if we continue to put restrictions, okay, this was allowed, but now it's not. This is allowed and now it's not. Mm-hmm. You create a barrier to entry. And I am less inclined to rent my home out. And the supply of homes for affordable housing will necessarily go down.
Well, let me share with you. And
I would think. Maybe I'm wrong.
Well, this may make matters a little worse because the law doesn't just necessarily apply to affordable housing. The law applies to any housing, any covered housing, whether it's private or subsidized by the government. So even if your home is private, you are wanting to rent to someone who does not receive any type of subsidy, it still applies to you. And so unless you have, let's say, 3 homes or less, then the law does not apply to you.
So if I have 4 homes on the end of a block, I'm sorry, Mr. Chairman, can I?
Go ahead.
If I have 4 homes at the end of the block that I own that I'm renting out, and I have a common area that people can wash their car at. You know, it's a place that if you wanted to wash your car, you could pull up this common area between these 4 homes. And the teenagers in the homes are, as teenagers are wont to do at times, they kind of get into mischief. And every time they come by, they swing a bat at the brick on the common area. And I send out a text to my renters and said, listen, because of the damage that teenagers are causing to this property, teenagers need to be accompanied by an adult at all times, then I have violated the fair housing law.
So there is nuances to that. So let me break that down. You own 4 homes. Let's say you also own 3. You're exempt if you own 3. However, if you use some type of discriminatory statement or if you utilize a broker in terms of the rental or things like that, then you lose that exemption. So even though you may have been exempt at 3, you lose that exemption under those 2 areas. And then for you with the 4 homes, if you are making it overly burdensome for teenagers and it is inhibiting on that family's ability to enjoy the property, unfortunately, that is illegal and unlawful based on the Georgia Fair Housing Law.
So my desire to protect my investment, it just appears like we're artificially raising the barriers and we're going to have fewer homes for people to rent. So.
Thank you. Chair recognizes Chair Pennyhouse.
What about these different places that just have 55 and older? Is that discrimination?
Yeah, so that's a really great question. So 55 and older and 62 and older properties.
Maybe I should say 65 and older then. Okay.
So 55 and older and 62 and older properties are exempt under the law with the exception of familiar status only. All the rest of the protected classes apply to them. Disability applies, religion, race, but familiar status does not apply. As long as they maintain 80% of that property as 62 and older and 55 and older, they do not have to allow children to live there.
Okay, and the next quick thing, you went back to his question about destroying the brick property, and you said it kept the teenagers from enjoying them. What about the other people that live there that would be kept from enjoying them with teenagers breaking things?
So that's a really great question. Also, there are rights that you have under the law as well, because I can talk about this all day. In terms of if you feel like it's creating an undue administrative burden on your property and your business or an undue administrative and financial burden, you can deny, and then we'll investigate. And if we determine that it did create that undue administrative burden on you or an undue financial burden on you, then we'll say that it was no cause.
What about the rights of the other people renting? Don't the other renters have rights?
They do have rights as well. If there is noise, we take those things into consideration, and we look at it as an undue administrative burden that this individual is causing harm on your business and individuals that live there. Yeah. And so those particular cases, we do go no cause on.
I understand, and I just hate to think that people being discriminated against. If it was really discrimination, but when you're tearing up somebody's property and stuff, it's a little bit different.
Actually, and you are responsible for that damage as well.
Is that right? My service animal is a pot-bellied pig.
It's funny that you say that because we had a case where the individual had a pot-bellied pig as an emotional support animal. But here is... So I'm glad y'all brought that up because we did have a case. The individual lived on the 3rd floor of an apartment unit, and that pig did destroy that apartment unit, and it also destroyed the areas around the apartment. And we went no cause on it. For example, she said that she needed it for an emotional support animal, but in our investigations, we found out that her dentist is who certified that she needed the emotional support animal, not a psychologist. So in situations like that, we do thorough investigations. And if it's not discrimination, it's not discrimination. And in that case, it was not discrimination. Your dentist takes care of your teeth, makes them pretty, and they do not, they're not able to certify whether you need a emotional support animal in terms of your mental health.
Thank you so much for the information. It was very informative. Thank you so much.
Thank you for having me.
We're ready. We're ready for our next presentation from Georgia Matters, the Rural Georgia Film Industry Panel. Let's give them a hand as they come. Well, they gonna barbecue that pig out?
I was gonna cut him up.
Okay.
We got one. 6:30.
We're gonna get rid of Al Williams.
Al's my biggest fan.
No questions from Al.
My question's right before I leave.
Go ahead.
Go ahead and ask a question, sir. No,
We're not gonna let him go before you go.
not before.
We're honored to
I
have
don't
you all
know
here.
if I can get you in a movie because you kind of got a face for radio, but
No.
like this, you couldn't miss. I'm gonna sit here with my panel, these lovely ladies, if y'all are ready to get started using that podium. But my name is Matt Campbell. Many of you know me from the state capitol, and I have the honor, Mr. Chairman Green and Chairman Jackson and members of the committee, to come before you today to talk about the rural film and entertainment industry. Also, it's really more than that. Now it's the new term, and it's a good term, creative economy, because it's bigger than, what you think. It's bigger than just filming a few movies or commercials. It's bigger than just writing some songs. It's huge. It's everything from artists to video games, right? Game creation, esports, it's huge. Georgia's a huge hub for that. There's a lot going on around Atlanta with all facets of the creative economy, as you know, but what we're here today to focus on is what's going on in other parts of Georgia, in the rural parts, the regional parts, South Georgia, West Georgia, coastal Georgia. And so I have two people that work in the industry with me today. The first to my left is Miss Kathy Parker of Philanthro Films and South Georgia Studios. She hails all the way from Quitman, Georgia, Brooks County, just next to Valdosta, Lowndes County. And Philanthro Films, she'll tell you more about it. I'll just give you a brief rundown. Is a nonprofit. They have a film school, a film camp. They produced a feature this summer that I watched for the first time in their studio, a little testing studio, I guess, where they watch their work for the day, and the directors and producers go back through there and they look and they see, what they could do better. Anyway, I watched this film and I actually teared up a little bit. It was beautiful. It's a 30-minute film made by students in this film camp, Georgians, a diverse group of young kids working all together from South Georgia. And, there's so much opportunity, and the sky's the limit. The next panel person, lady here, is Deborah Moore. She's come up from Pigmental Studios, which is in St. Mary's. Not only in St. Mary's, Camden County, down on the coast, but they're in Los Angeles. And Marina Martins, who is a brilliant graphic artist, teaches that in Washington, D.C. through Pigmental Studios, and she can touch more on that. And they do some very wonderful things. And they, too, have plans for a training program in southeast coastal Georgia. It's very, very neat, very cool. Aaron Buzza from Visit Macon was going to be joining us today on the panel. He ran late with another meeting. He didn't make it, so we're not going to hear about that, but I'll touch on some Macon things before it concludes. I'm just going to go over a brief overview real quick after these introductions. Like I said, I'm Matt Campbell. Georgia Matters is our government relations firm. I also have the pleasure of helping and kind of guiding this new alliance. If you see your screen, you'll see these new alliances that have popped up over the past, I guess, year or so, 6 months, to try to help other parts of the state, to try to get outside of the Atlanta bubble. Nothing wrong with the Atlanta bubble. We don't, you don't want to steal anything. We're not taking anybody's pie, but we believe there's enough there to make a bigger pie where everybody can have a piece. And so you've got the Coastal Entertainment Alliance. I live in Richmond Hill, just south of Savannah. It's my hometown, just down the road from Representative Al Williams. He's in the next county over. And we have the development authorities, the chambers of commerce, business interest groups from Camden County on the Florida line all the way up to Chatham County, Savannah, that want to see more opportunity. And so they've come together and formed an alliance, and it's a very cool thing to see. Up north, Rome, Georgia, not too far from here, Representative Katie Dempsey's district. They've recently filmed the Rome Film Alliance. They already have a very cool culture up there.
That's what they're doing in rural Georgia.
Yeah, we're going, and we're going. This is she's right here. Yeah. So and then you got all of them are together in the GRFEA, Georgia Regional Film and Entertainment Alliance. Those are alliances that are promoting everything. So the GRFEA, Georgia Regional Film Alliance, is part of rural Georgia, as are the others, but it's GRFEA, part of rural Georgia, and South Georgia Studios in Quitman, near Valdosta, is part of that alliance, as well as some other groups, and we'll get into that here in a second. Film production is huge. Those are just a name of a few of the ones outside of the Atlanta bubble. Philanthro Films and South Georgia Studios, she'll talk about all the good things they're doing in rural Georgia. These other ones, Athena, right down the road in Athens. Cinevantage is one of their groups down in South Georgia. Pigmental, and then you know about SCAD down in Savannah. Flat Rock is in Columbus, so Columbus, Georgia. The creative economy, and this is just some quotes from a good report done by Georgia State on the overall economics of it. But that creative sector lifts all people, and the legislative stuff that you all have done over the past several years has really stimulated the Georgia economy. And it's really statewide. It's getting down to rural Georgia. You're seeing more jobs created, training created, workforce development in all parts of the state, all the way down to the Florida line. And it's really cool. And it's not just, like I said, in film and music, it's other parts of it. Before we go to Kathy, I'm going to play one quick video of South Georgia Studios. I think you'll really like it. It's rural. It's in Quitman, Georgia. And it's coming soon. There. Cool. Pretty nice, isn't it? So she's part of this project. So I'll turn it over now to Ms. Kathy Parker of Philanthro Films.
All right. Thank you so much. I am a Georgia native. I reside in Lowndes County, and as Matt said, over in Brooks County is where we have our offices. And I will tell you, I didn't have a background in film, but I had a story about a philanthropic project that I did, and I had producers come in and try to, tell my story. And for years, I didn't do anything with it until finally I met someone and I learned about independent film. And my husband's a high school football coach, and we were living in Baxley, Georgia, and the county administrator came to me and said, Kathy, we lost out on an opportunity. Disney came through Appling County and found some property. They wanted to film the movie Dumbo, but we didn't know how to answer all their questions about permitting, and we lost the opportunity. You know about film, can you help us? And I was like, well, I really don't know about film. My background's in philanthropy, but I know someone who does. And I got my producer, Honey Korngold, on the phone, and I said, have you ever considered coming to Georgia to do film and put your offices in Georgia? And she said, that's the best place right now. It's where the tax incentive is, and it is the best place. I said, well, how about rural Georgia? And it was a little difficult because I thought my baby was pretty, but I didn't know if somebody else might think my baby was pretty. But people in Brooks County, that was one of the places that I had worked for about 10 years. They said, please come to Brooks County and let us work with you in Brooks County. So there were a lot of things that were positive. Number one, there's an airport. There's an airport in Valdosta that we can use. Number two, a lot of times in these rural areas, and I had worked for years for Boys and Girls Club and some different organizations, there's not a lot of options. So when you do present something educationally for those youth, they jump on it. Now, you all know, if you have children, grandchildren, you know they're all with their phones. They're already doing filming, okay? They're already doing it. They're loving it. They're loving all those digital arts. But to give them an opportunity to see how they can monetize that. And we're part of Georgia, so we get that same 30% tax incentive. And so it was like, why not? So we started partnering and we started our nonprofit, Philanthrofilms, to build up a workforce. We did it different than a lot of other places have done it. I know you'll hear from Deborah, they're doing it the same way with education. We started first with the workforce, and we started doing camps, and we started partnering with what we had in our hand. What do we have? We have school systems. We partnered with 7 different school districts, Valdosta, Lowndes, Brooks, Clinch, all these other school districts, and started teaching their audiovisual technical instructors. These are jobs that are available right here in Georgia. Let's raise up our own workforce right here. And so we did that, and they went back to the classroom to 600 students that they could show this is how you produce a film from start to finish. Then we started opening up offices. You know, something in our rural towns is there's a lot of old buildings, and a lot of them are falling down. So we just started getting those buildings, and we started fixing them up, one after another. We have our offices there. We have an office with 13 people working in that office. 5 of them are from AmeriCorps grant. These are things that we need in South Georgia and all over these rural areas. You know, I've had people say to me, well, you can't do that in South Georgia. You're not near Atlanta. You're not near this, not near that. Well, we can do it if we build up the workforce. We absolutely can do it, and we're doing it. We're doing it so well that we got the attention of the Georgia Film Academy, and they will be opening a campus. They've already partnered with ABAC, Wiregrass Technical School, Southern Regional Technical School, and Valdosta State University, and we'll be housing that on our campus in Brooks County, something that's never been done before. So that's what we represent. We have a bright future there, and our hope is that one day we will be a hub for all training in film, and that we'll be able to produce multiple. We have 112 acres that we've purchased, debt-free, and we're going to be building. And we will be a hub for film, and we will be able to do film in this rural area of the state. Thank you.
Kathy. Up next, we'll go to Deborah Moore with Pigmental Studios.
Well, you're a hard act to follow. Thank you. I'm very, very excited to be here because I think this is an exciting time, certainly for, the rural Georgia area. I was invited to Atlanta about 5 years ago by a friend of mine who was from LA doing movies here, came here, stayed. My husband is a stunt coordinator. I'm a producer. We've been working here. I've done about 5 movies now in Georgia. And a friend of mine called me one day and said, I've been doing these, she's been running a program at Gallaudet University, which is the largest deaf university in the United States, and she was looking to create an additional hub I happen to know Jim Jacoby, who's a land developer. He had developed Atlantic Station, a number of things, and he had just purchased 1,300 acres in St. Mary's. Most gorgeous waterfront property. It's amazing. And, I called him and I said, do you have any extra space? Because he loves the film industry, and so he also wanted to do something there. So we aligned with Jim. We have now 67 acres for our own sort of film studio. But before that, what we're doing is we're now creating an animation studio and teaching program for the deaf in St. Mary's, and using the same methodology that Marina Martins, who actually is the owner of Pigmental Studios, she went in to do a program, just one single class 6 years ago at Gallaudet, and it's evolved into an year-long program that she's been doing for 6 years there. So we're using that same program to train deaf students. There's a very large deaf school in Augusta, and so we're going to pull from the community in the St. Mary's, Camden County area to train people how to work on animation, not just deaf students. We will open it up to anybody, but that's our primary focus right now. And that's part of the nonprofit that we're doing in that area. In addition, we're going to be doing training for a lot of the other crafts that are in the area. My background is finance. I forgot to even tell you who I am. So I've been in the film business for 30 years. I was formerly the head of physical production for a company called New Line Cinema. So I oversaw movies such as Dumb and Dumber, The Mask, Teenage Mutant Ninja Turtles, all the early Nightmare on Elm Street movies, and I did about 80 movies with them, and since then I've done a number of other movies. So I've done somewhere over 100 movies all total where I've either produced or overseen or something like that. So I'm bringing that level of expertise to St. Mary's, and we're going to be training people, but we're also looking to train them in the administrative areas that, everybody wants to be a grip electrician or a camera person, but we're focusing on the financial world, the accounting. There's a huge shortage of accountants, not only in Georgia, but across the country, for people who understand the film program, the accounting programs, the software programs, and whatever. So we're training people to do that. There's, just the coordination, the clearances, all sorts of different things that don't have to necessarily be on set. One of the things we've been tasked with by the Navy, because we're at Kings Bay Naval Station, is 2 miles from us, all the military wives and their kids that are growing up are looking for work, and they need to stay. They can't leave. So we're creating these job opportunities for them as well. So, and there's I think 9,000 military members on that base. So we have a huge population of people to pull from, and so we're looking to create jobs in there. The other thing that we're doing is we also have our own films that are fully developed. Marina has 2 animation series that we're already working on. So partially funded one, the other one is already getting ready to start working. And so not only are we training people, but we are going to be in a position to provide them with jobs for these animation programs. And then separate and apart from that, we've already got 2 producing groups that want to come in. One, they're moving to St. Mary's. They're going to be doing their projects there. And these are some of the smaller projects. So that people can start training and learning the craft. In addition, we'll be building studios as well for our own projects and for the bigger clients that are similar to what you guys are doing. And I don't think I think there's plenty of room because we offer a completely different look than, say, you might offer. So we have the coastal waterways. We've got all of that Southern Georgia has, which is just gorgeous. The fun thing when we were, one of our people who's sort of designing a lot of our facility, when Jim Jacoby bought the 1,300 acres, they took a drone and they were going over the land just to see what they had because it's so massive. And they found 2 different things. They found a rookery where the nature had basically come in and surrounded the lakes and the water, these waterways. And there were thousands of birds that had been living, nesting, creating their little families, alligators, whatever, completely sequestered and haven't been bothered by anybody in 40 years. So it's I can't even quote all the names, but all these different beautiful pink birds and yellow birds and birds with big long stalks and long legs, and they're magnificent, and they fly in and out of there. And the other thing that we have is the 1,300 acres is a reclaimed paper mill, and so there's a 10 million gallon tank that we're cleaning out, and that's going to be a filming tank for both research for any of scientists that want to come in and do underwater work, and also for filming. There is no water tank in the United States other than the one in Universal, which is not nearly as big. Otherwise, you have to go to the Dominican Republic or Malta to shoot in a tank. So we have this existing tank, and we have a 12 million gallon per day output, and I know I'm going to get those numbers wrong, to fill this thing. So that's not going to be an issue because that's what the paper mill had all set up. So not only do we have that to bring people in, but we're creating our own content, we're doing the training, and we're doing it all in this beautiful little area that I didn't even know existed in Georgia. So I'm thrilled to be down there.
Thank you. Thank you, Deborah. That's a little bit about what's going on in rural Georgia. Yeah, it's very cool, seeing what's happening down there. These groups that are on the screen are some rural folks and some what they call regional folks, outside of Atlanta. So 90%, I guess, of Georgia's film industry happens in Atlanta area. Savannah gets a good bit, I think 5% or so, 6% out of that 100. So 95% is gone, and the rest of rural Georgia gets about 5%.
That's going to change.
That's right. There you go. And that's going to change, and that's what the goal is. And I think that that's something that all of you from rural parts of the state can agree with. Over the past several months, there's been this Georgia Entertainment, a company that does a lot of film entertainment publicity and support. They go around the state. So been in Warner Robins. There's a what they call the unscripted roadshow, and it's going to happen actually down in their area that they're helping with in January in Valdosta, and that brings in different small businesses from all these different places, and it's just really, really great to see all these different Georgians from different parts of the state with prospering businesses all brought here from the entertainment industry, and so there's so much opportunity out there. Georgia Film Academy is a big part of that. They're training high school students, and they're doing a lot of good things, but those are a few of the different groups that are involved in the regional and rural film alliance. And anyway, I'll be quiet and we'll take some questions if you have any.
Thank you. Chairman Green.
Thank you. This is exciting what you've brought to us, and thank y'all for what you're doing there. What are the challenges you're actually facing in rural Georgia? What's something that you can share with the committee?
The thing about being in a rural area, of course, is just accessibility to things, and you have to use what is available to you. You have to, the partnerships. A lot of times in some smaller communities, you might have the city that doesn't work well with the county, that doesn't work well with the school system and all that, and you have to all work together. Because you have to get anything done, you're going to have to work together. You're going to have to use, you have these high schools, and I've been in these high schools that have these massive culinary kitchens, and so we've started partnering with them because when you have a film going on, you're going to need catering. And you've got students that need to be trained on how to run a business in catering. And I loved what you said, Deborah, about the accounting. You don't have to live in Atlanta to work as an accountant in film. You can work anywhere in the state and be an accountant. Mm-hmm. So it's like taking what you already have and using it. So that's our biggest challenge is talking to the entities and getting them all to work together. And, I know in Columbus, they've done where they've come together and they've done an uplift for the community for film, and that helps. If we can, as much as we can, drive film outside of it, and Atlanta has got their share, but as much as we can to drive it throughout the state to give opportunities. Because what happens in these rural areas, if your kids leave to go get trained somewhere, they're not coming back. If you can keep them there, you can train them and give them work, then your economy thrives.
Yeah, no, and I would agree. One of the things that we had to do was, and we have somebody who works with us, Jennifer Elders, who's just amazing. She got all of the 5 major cities in Camden County together, and we created a universal film permit. So from when a producer comes in, there's the ease of working with all the different entities. It's already spelled out. So that was one thing. One of the big challenges we have is that we don't have an international airport. So we have to fly people either into Atlanta and then somehow get them down to St. Mary's, or we fly them into Jacksonville, which then mitigates the incentive on that flight because we're not flying into Georgia. So that's one of the things that we're dealing with now. I know there's talk, I guess there has been for many years, about putting an international airport in the St. Mary's, Camden County area, but I don't know if that's going to happen. We did have an airport, but they shuttled it right after 9/11 because the military base is 2 miles away, and so they couldn't have jets flying over the submarine base. So that's one of the things. And the other thing that we're contending with, of course, is that we don't have crews, so we have to bring crews in from elsewhere. We can bring them in from Jacksonville. That's an option for us. Or we can bring them in from Atlanta, which is where most of us know the crews there because we have been working in Atlanta. And so the offsetting the cost of that, like they do in some of the other places where there's an uptick for for shooting in that rural area to offset the cost of housing and per diem and cars and just keeping somebody on the ground.
And that's why it's so important to train up our own workforce in film. So you don't have to pay that per diem. You don't have to bring them in from Atlanta. And it gives jobs right there to the people in our area.
Go ahead.
You know, I believe every one of our counties in the state of Georgia are what we call film ready. How has that affected y'all? I mean, do you look at that particular the information there? Does it?
Okay, so you asked, so I'm gonna answer it.
Please do,
honestly,
because we want to know.
It's broken. It comes out of Atlanta, and when we've asked questions about needing help, in fact, when Honey Korngold, the producer who has moved to South Georgia, her production company, when she called and asked, about the camera ready, they were like, well, move your production company to Atlanta and we'll help you. And we were like, no, we're here. We're not moving to Atlanta. So we've had to do it on our own. There's not a lot of help. There's not a lot of support. Yes, there is a Georgia Camera Ready. Nobody knows how to work it. It's very difficult. And so what we did in Brooks County is we told the entity there, the Development Authority, we said, we'll run it for you. So free of charge, we run the film office in South Georgia for the whole region because no one else knows how to. And because we have a film producer like Deborah that's moved to the area that can show us how to do it and what producers are looking for, that has helped a lot. But we don't get the resources we need from Atlanta.
Well, that's very sad to hear because our groups went out in the counties and identified all of these areas, put a great deal of stock into it, and but thank you for being very candid about this because I think the legislature might be able to do something here to help you.
Thank you.
Yeah, and we had to do the same thing. We've put up our own website. We've coordinated with the Georgia Film Office. We've actually had a bunch of meetings this week with everybody to let them know what we're doing so that everybody knows we're there. And I think, in all fairness to the Camera Ready program, as a producer coming in, when I first got to Georgia and I'm looking at 130 camera ready cities, I don't know what they look like, or that takes a lot of time. So it would behoove somebody to say, oh, you're coming into Georgia here, look at these 5 counties. That would be more helpful than just going onto the website. And it's like, I don't know where to begin.
help us with that, and we'll see what we can come up with.
Thank you. Chair recognizes Chair Darlene Taylor.
Thank you, Mr. Chairman. I'm from Thomasville, so they've filmed a few films down
Yes.
there. But one of the things that I had heard before is there was a little problem with union, and I think you intimated that it is a travel issue. You have to pay a little bit more. Is there any hopes of getting a union or get enough films being made where that location is there and then it isn't a travel expense? Is that something we need to work on?
Yes, ma'am. Now, you will fall into the Savannah Union, correct? Or because you're
No, actually, we're not. Savannah is in the North Carolina Union.
Okay.
We are in 479.
okay.
Okay.
So our area is not in the Union area, and so we have a 60-mile radius. And so to be able to not have to pay the per diem. Yes, there will become a time that we'll probably have to unionize, and that will probably help us, because I know it can be very difficult, and the union can make that difficult if you're not a part of it. But for right now, like, we have a big film that is supposed to film next year, and so we're hiring as many in that 60-mile radius as we can.
Thank you.
Yeah, and I just wanted to mention on the same thing, you know, the unions come into play when the group of people on the movie request that they are represented by the union. So it's not like an area is a union area or not. Obviously, 479 is very pervasive in Atlanta. I don't really think you can do non-IATSE movies there. But in our area, the reason we would do a union movie is because that's where the crew base is. Or we could do non-union if we're training our own people. And as far as the per diem and housing, that's whether you're union or not union. You have to put people up. You have to give them money to eat. So that becomes more of just a human nature type of thing more than a union thing.
Thank you.
Thank you. Chair recognizes Chair Pennyhouse.
Thank you. And getting back to not getting very much help from Atlanta for your film thing, maybe I'm not making excuses from them, but you know, our film division of Department of Economic Development has very few people working in it, and maybe we really need to increase the staff, and maybe they can help y'all. And I'm sorry that y'all haven't gotten the help from that. And Representative Hatcher and I'll be checking it. It comes under my budget, and I'm sorry y'all haven't gotten any help from it. And I will check on it, okay? The next thing, if you have any trouble getting people not flying into Jacksonville, tell them to talk to me. They have valet parking down there at the airport, and everybody, and you'll find out that most people in Southwest Georgia fly into Jacksonville.
And that's what we're finding.
It is really going through, huh?
Yeah, we don't get
you don't get the credit.
You don't
that
get
goes
the
to
incentive if you don't fly into a Georgia airport.
No, just flying in.
Right. So we have put forth the request to, you know, certain people. If
You've got to use that Atlanta airport to get the credit.
you have to use a Georgia airport. So yeah.
Yeah, but you can personally fly in. I mean, your personal money.
Right there.
Well, I don't know, just give them a per diem or something, let them pay for
Well,
it.
you know, and Florida doesn't have the tax incentive, so for film.
but
So
I didn't
maybe
realize
a
that
deal can be worked with them.
I
Something to
didn't
consider.
realize you had
Yeah.
to fly in. A personal person had to fly into a certain airport.
Yeah, we're looking into flying into Brunswick, which is a little closer, but there's no nonstops. And, you know, when you have actors, they don't
Yeah.
like getting off a plane and having to get onto another plane. And it's just a time factor and everything else. But Brunswick is not the most, they don't have that many flights coming in, so.
And, you know, and the tax incentive program is to build Georgia jobs and build the Georgia economy, which is the reason why, you know, the airport in Florida isn't there, even though it's the closest and would make sense to include it if that would even be an option. But, you know, the programs to build Georgia jobs and to build, you know, the Georgia economy and keep us going the way we are. I mean, and like you said, the Economic Development Department, you know, in that area may need some help with rural Georgia, but they do have a lot on their plate. You know, Georgia's the #1 state for a reason. Film, entertainment, gaming, which the gaming esports Super Bowl just about is coming to Atlanta in December, the weekend of December 15th. So if you're the esports, so you can get a college scholarship now for playing video games. And there's people that are coming into our state from all over the world. And it is very, very cool, so think about a young man or young lady who likes to work on computers and that types of stuff. They can be a game designer, game programmer, not just play the games, but actually do the graphics and do the, the technical stuff that I have no idea how to do. A lot of people don't, but there are some very gifted people, and Georgia is a huge hub for that. Very, very great for the economy. Now, they don't come under the tax incentive and all that stuff, but they bring a lot to the table in our entertainment sector.
Yeah, and that's one of the things that Marina Martins, who again owns Pigmental Studio, she has a gaming component to the company. We have the animation component and then the live action component. And we're not trying necessarily to compete with the Atlanta shows. If a show's in Atlanta, it's there for a reason. But we're there because we offer things that Atlanta maybe doesn't offer, and there's plenty to go around so that we can capture some of that other work. And I think we'll be very successful in a couple of years, having built up the workforce and everything else with just a little bit of help as we're getting there.
Thank you so much. If you'll give your contact information to Leo and Stacy, we'll talk offline about some of the things that we've discussed today. But thank you so much for being here.
Thank you.
Thank you. Ron Stevens, Chairman Stevens, just sent me a little note. He said amen, so he must be listening on that. And great person who has been Mr. Filmmaker in the state of Georgia for all of us. Thank y'all again. Well, we're coming down to the last speaker from the Georgia Forestry Commission, our director and state forester, Tim Lorman. If you'll come on down, Tim, we'll get you set up, ready to speak.
And you want to be out after dark or before dark?
You can take whatever. You've been a friend a long time, and we'll be a friend even after your long speech.
No. Thank you so much, Chairman Green and Chairman Jackson, for the opportunity. And I was looking at the agenda, or I guess a little earlier this week, and I realized that I'm a little different than what you've been listening to, but you have been listening to some really important talks about healthcare and the film industry. And, I was thinking about, I was like, how do I fit into this? And I think really, as the more I thought about it, the more I got excited about it, because you guys have been listening to some really important topics. And as well as I know, as members of the General Assembly, we try to talk about agriculture and forestry as being an important topic. And I think it's really great that I am included in a meeting where you have been talking about such important topics to our state and to rural Georgia, and you're including forestry as part of that. So thank you for the opportunity to be here with you folks today. I will be short as I can, and I will try to answer any questions you have. I'm going to spend most of my time speaking about the work that we've done at our agency as a state agency on workforce development and solutions that we've put forth. But at the end, I want to talk more broadly about what's happening in our sector, because I think that's important to the discussion as well, and they're really important for your knowledge, for the knowledge share here as well. So just for you guys to be aware of that. Some of this will be new to you. Some of this won't be new to you. Many of you in the room as leaders have talked with me about this and have worked with us as an agency and with me as a leader in the agency to get some of this implemented. And for that, we are extremely thankful. So as Chairman Green introduced me, I'm the director and state forester of the Georgia Forestry Commission. I'm about 25 years into the forestry profession. I have been with the state agency now for about 2.5 years, and I'm very honored and very thankful for the opportunity that Governor Kemp has provided for me to lead this great agency. and for the confidence and the trust that he had in me to give me the opportunity. So before that, I was in the private sector. So some of the tools and some of the solutions that we've brought to our agency are things that I've learned along the way. Really just kind of goals for the day. And I want to talk to you about some of the initiatives that we've put forth. I think they're helpful. I think they're helpful to share. I think they're helpful to talk about. And hopefully others can learn from some of those initiatives. And then we're going to talk about why getting the workforce development issue is right for us and why that matters for us as an agency. And then I'm going to spend a little bit of time on there's still work to be done. This is a very, very busy slide. I recognize that. I just want to point out a couple things there that I think are, and it's really down in the results. What's that? Oh, that's fine. Chairman Houston. You can sit anywhere, Chairman Houston. Yeah. There you go. You sit wherever you would like. Yeah. Really on this slide, it goes back to FY18 for us on the bottom about our historical turnover. And it's talking about, and it shows just the direction and the trend that we're heading. And I want you to take a look at that. But really what I want to talk about, and this is almost why it matters, and that's this results, the bullets down at the bottom. And it's 56% of our employees have less than 3 years of experience, and 46 of our wildland firefighter employees have less than 5 years of experience. And then roughly 50% of our foresters are somewhere in that 3 to 5 year, have less than 3 to 5 years respectively. And that's a result of what that busy stuff is on that slide. It's just that churn and just that work through of employees and the turnover of employees, hiring new employees, not to mention the cost that comes to the agency and really to the state when you have that kind of turnover in the past. And it's important to point out, I'm talking about wildland firefighters and I'm talking about foresters, which are very skilled in very professional types of roles in our state. We have about 550 employees at our state, given the day of the week and given the time of the month. About 400 of them in the firefighting community, and the rest are in the forester category and the administrative category. So fairly large organization. We're spread out all over the state. In many of your districts, we have 109 offices around Georgia. And we take pride in that, and we take pride in working in those communities and supporting those communities every day. So when I got here in 2020, as trying to just get the lay of the land and understand what our agency, what was happening, and just try to understand what we needed to maybe move forward with. Spent a lot of time as a leader just listening and just going around and hearing from our folks and visiting one-on-one. A lot of miles on a vehicle, a lot of time on the road, but I think it was critically important for me to get out and listen, have a tune, understand what our business was, understand what our mission was, understand what our priorities were, and then really spent some time on creating a culture and getting the buy-in on that culture. And you can see the 4 aspects of the culture that we established and that we hold true to that today. And that's, this was not a culture. We didn't have values in our organization. We didn't have those established. And I was a bit surprised when I came to the agency. And I would dare to say that there's other state agencies that may not have values listed and recognized. And I think that's a missing point. If you don't have that as an agency or as an organization, if everybody's not aligned with those types of values, or at least hearing them and talking about them, that's a missed opportunity. And so we did that as a leadership group at our agency. We talked about integrity. We still talk about that. We still talk about respect and equality for everyone. We use facts to drive decisions. And we take a responsibility for our own success at our agency. And then we took the next step, and that was to get garnered leadership support for the things that we wanted to accomplish as an agency. and wanted to really deal with. Our number one issue when I got here was workforce. It just was. And I think every state agency, what I have learned since being in state government, wrestle with state employees and employee satisfaction, employee recruitment, and employee retention. And we hit that head on, and we spent a great amount of time and a great amount of resources on that very issue. This is kind of the timeline of sort of what we have done since January 2020 to July 2023. What I want to point out there and what I want to acknowledge here is that the support and the appreciation that we have, the support and the recognition for the work that this body as a whole took to invest in our organization. Thank you for hearing what we were trying to accomplish in improving our workforce and retaining our workforce. Thank you for understanding what we do as an agency and what we offer this state. And you invested in us. And I talk to our employees every day about each one of you being our investors. And that's something I brought from the private sector. And that's a whole nother way of talking about trying to get appropriation dollars. And you have to earn investment, right? And so we have to earn that every day. And that's what I challenge our employees to do, is to try to look for relevant opportunities and to be present in the communities and earn the investment from our investors, which in this case are our state legislators and then ultimately our taxpayers. So when I started here in January 2020 and walked in the door and realized our starting salary for our wildland firefighter, who has a commercial driver's license, who knows how to operate heavy equipment, who is a trained, nationally certified wildland firefighter, was making $30,000, it was very easy to see why we were having tremendous turnover and trouble with retention there, because they're highly skilled individuals. And our foresters were making $39,000. Fast forward to where we're at today, and through the tremendous work and support that we've had from this body and from the governor's office, we're heading in the right direction. And our employees now, our wildland firefighters they're starting at $41,000, and our foresters are at $50,000. Now, is that where we need to be? I think that's to be determined. I can tell you anecdotally what I'm seeing and what I'm hearing from our workforce. We have peer-to-peer recruitment happening now, and that was non-existent when I got here in January 2020. Never did we have an employee in one of our county offices bringing in one of their friends or one of their relatives or recommending someone to come to work for us. We're seeing that today more and more. I was just in Mitchell County yesterday at our office, and I was there having lunch with the guys. There were three of them sitting around the table. They've got one vacancy. They had a gentleman that left that had 6 years with us and left for another job. All three of them had someone that they had recommended to apply for that job. And it just was, I think that is what we're seeing is heading into the right direction for our agency. And largely that's been done by the cost of living adjustments. What I do want to point out is that August 22 circle, and there's a lot underneath there to unpack. But we looked and implemented some strategic initiatives all the way across our agency. We expanded our career ladders. We had a 2-year career ladder. And once the end of that 2-year career ladder, we were losing employees. They'd fly out the door because they didn't have anywhere to go except to promote up into a leadership position. And those opportunities don't come that often at the local level. So what we did is shifted that. We did look at our data, and we could tell that if we kept an employee for 60 months, chances are that employee stuck with us. And so we expanded our career ladder to match that 60 months to about 72 months. If an employee is extremely diligent, they can achieve all they need to do in 60 months, 5 years, and have a career ladder. And that has been tremendously successful, been received extremely well by our employees. We did some internal restructuring of funds, and we brought everybody up on that career ladder. We just didn't move the newly hired employees into that. That was a little bit of a risk for us, but it's just managing cash flow, which, for some state agencies that may be challenging, but for us, we were willing to accept that risk and manage the cash flow, and we were able to implement that. our agency didn't treat supervisors differently based on their responsibility of supervision. I mean, who would have thought that? We've been around for 100 years, and if you had a supervisor that was in the chief ranger position and he had 5 people he was supervising and another one had 2, they got treated exactly the same. And that was just so foreign to me, and we adjusted that. So I think that was pretty neat. And then the other thing that we took that for me as a leadership person, and it talks about that integrity and respect for our employees and recognizing the fact that we had a lot of new employees, and we still do have a lot of new employees, is that we instituted a safety campaign, and we still continue to promote that across our agency as well. And really where we've reached today is we've got a tremendous morale that I believe is as high as I've seen it. I know it is since I've been here. We've got peer-to-peer recruitment, and then our employee engagement is certainly has been improved. I just want to kind of say there's still work to do. And I'll point to these 4 points. I could have put probably a list of 50 things on this slide to illustrate the amount of work to be done. But if you have employees and if you own a business or if you run an organization, you know that wage expectations from employees continues to their expectations continue to increase. And that is from your existing employees, and that is from your new job seekers as well. And we got to know how to deal with that, and we got to be aware of that, and we got to work on that as we go forward. And we're committed to doing that. We're aware of it. It's front of mind to us. And then we also have to recognize and realize that Georgia's a great place. I mean, it's an excellent state. We just heard about the film industry and the opportunities in it. Y'all have probably heard about opportunities in healthcare and the shortages there with doctors and there's probably lawyers in healthcare, nurses in healthcare. There's 2.5 jobs for every one available Georgian, unemployed Georgian. So the opportunities are still are rampant and available for people in this state. And I read a report recently that was put out by our Department of Labor. I believe it was Department of Labor. It may have been DH. I still haven't learned all the acronyms, and I've been here 2.5 years, so I apologize, but that hadn't been something that's been critical for me. But it was a trend that said by 2028, there were going to be 550,000 new jobs in our state. So the gas pedal is not letting up for our state, and that's a good thing. We like that. But I think what that means for us existing organizations that are here, state agencies, private agencies, is that we can't take our foot off the gas pedal on the successes that we've had now to fight to retain those qualified employees. I'll just switch gears and look and talk about some of the things that are going on broadly in the forestry sector. I've told you I've been here in the forestry sector. I graduated from Warnell, which is right across the street here, Warnell School of Forestry and Natural Resources in '98. And I still remember when I was in school there were like 2 pathways when you got out of school where you could go to work. You could go to work for a procurement organization, or you could go to work for a land management organization. That was about it. The opportunities now in our sector are as broad as they ever have been and are as great as they've ever been. And it's a great time to be a young person in Georgia. And it's a great time to be looking at forestry and the innovation that's taking place in forestry. And we're working with our partners across the state, the Georgia Forestry Foundation, the Georgia Forestry Association, and working on labor studies and looking at what the needs are for the entire supply chain. And we're supporting those efforts, and we're engaged in those. We look for internships. That was something that we were not doing as an agency. We had 6 the first year I was here. We had 4, and then we had 5 last year. Interns from colleges, from Auburn, Clemson, UGA, ABAC, and just really trying to create a pipeline and an experience that attracts talent into our sector. We've actually hired one of those interns, came back to us. I'm committed to that and to continue to work with an internship program. And we're partnering with private companies in the state to attract those internships and to share those internships with them to create opportunities for them and so that those employees can move over. If we don't have opportunities, that they can go and work with some of the private businesses in Georgia. And I talk about this, and we always get caught up, and our folks do this too, and we do as an agency. How do you tackle recruitment and retention and establishing a workforce? It's a big deal. It's a big issue. But I think you got to just bite the elephant one. How do you eat an elephant, right? One bite at a time. And that's what we're trying to do. And that's what we've been doing for the last 2.5 years. And I think we're seeing some success. Our turnover rate, and this may be the first time that I say this in front of our legislators and in a recorded fashion, but our turnover rate last year was less than 5%. And it's tracking right now. Our turnover rate now is 3%. There are businesses all over the state and all over this country that would be fighting for those. And I am convinced how we got there is our leadership team has just been biting the elephant once at a time. And we just keep biting the elephant. And we just keep biting the elephant. And sometimes, it gets hard, but I think you just got to keep doing that. And you got to keep just trying to keep your folks motivated and giving them really opportunity and giving them a hope. And, I think it's as great a time, and I've said this already, and I'll just end here and be glad to take questions. The forestry sector is a big deal to our state. The opportunities are as great as they ever have been in our state. And I've got a 17-year-old daughter. I got a 19 too, but I've got a 17-year-old daughter that about 4 or 6 months ago came to me. She said, "Dad, I don't know if I've ever talked to you about this." She said, "But I'm thinking I want to go to forestry school." And, I just encouraged her to go do it. I'm like, this is awesome. This is great. And so, I believe in it that much that I'm telling my 17-year-old daughter that the opportunities that this state, and this is where she wants to be, that this state and this sector and this leadership in this state, that they're committed to this sector enough that I'm willing to put my own daughter into it. And I appreciate the support that you guys have given us. I appreciate the support that you continue to give the entire sector. And I think it matters, and I think this sector matters. And what a great opportunity, Chairman Green, to be here to talk with you about some of the things that we've done at our agency, and we'll continue to do. We'll continue to take one bite at a time off of the elephant, and won't be overloaded by the girth of that. So, be glad to take any questions if you have any.
Well, I know one thing. As I visited, and I have a good many of the different forest units in my district, the morale is quite different. And I applaud you for the moving around and being with them. That means a lot to them, and thank you for that. Chairman Jackson, if you would.
We've got some questions. Chair recognizes Chair Darlene Taylor.
Thank you, Mr. Chairman. Just a quick question about infrastructure. Forestry is such a large part of our economy, and it's very important to it. And I recently was meeting with some folks in South Georgia, and the conditions of some of our dirt roads, or clay roads is really what they are. Are you seeing that? Is that something they are recommending that we get some more help on getting those roads just for safety reason, and as much as they're used and needed? We got torn up pretty bad a few years ago by a hurricane, and it's continued to affect the roads, the dirt roads particularly.
Right. So one way where we intersect with that is we have a website where counties can sign up to require the logging sector or timber harvesters to basically log on and to get to notify them where that logging operation is happening. So if there is an issue with a road, they could point right back to that website and go directly to who that was or that individual company. I haven't heard about it in a general nature. I do hear about it in periods when it's wet. We get calls about that very regularly when it gets wet. And when there's a tremendous amount of rain, but I haven't heard about it in a broad sense. And interestingly enough, most of the times I hear about it's in Middle Georgia, where you have clay roads more so than you do sand. But we do hear about it from time to time. And I would encourage your local counties to work with us. That's a free service. We've developed that. It's a pretty slick notification system, and it's all online. The county goes on, they'll get an email or when somebody goes on and signs up and puts where they're going to be harvesting timber, and they can track it.
Thanks.
Chair recognizes Chairman Steve Tarbin.
Quickly, this is more of an assignment than it is anything. Really appreciate what you've done. It's quite impressive and quite noticeable. You say 500 or 600 employees is what we got statewide?
550-ish.
550.
Yes.
This data may be available, but I don't want you to go to a lot of work. But when we see you in January, it'd be interesting to see, coupled with the success you're showing, and it may not be readily available, and don't put a lot of time in it, but average, I don't want to say average age of employee, I guess. I want to say average work experience. Years of service per year, and see if we can make a model out of this to that success, and see what, in 17 or 18, did we have a lot of older employees? It was time for them to go anyway. Then the morale got bad and that type of thing. I think this is a very good model for us to try to help some other areas.
Yeah, I'll share with you. That's a great point. I will share with you this. I didn't get into this, and I maybe should have. Trying to keep our employees engaged and giving them opportunity, and trying to create a system and a structure that promotes that and encourages. We're in the middle of a reorganization right now, and there's 5 region positions that are available. And we have about 15 applicants for those. And I could probably go through pretty quick. At least a third of them are people that could retire now or could retire immediately, or very short order. And they're committed to staying on and committed to being a part of our agency, which is telling, right? But I can look into that.
Correct me if I'm wrong. 3 years ago, we didn't have a lot of applicants wanting those jobs when they were vacant. Isn't that correct?
I told a group that this morning. I couldn't find a person to apply for a job. Even when I got here, it was very challenging to find an individual to apply for a job.
Thank you, sir.
Internally.
Chair recognizes Chair Penny Houston.
Thank you so much for what you've done. And I know all of this you get lots of credit for. It's been you, and thank you. Yeah. You've been a joy to work with. One quick question. I know the Georgia Forestry Association took a group of people to Europe last week, and just looking at the thing of manufacturing jet fuel through the byproducts of timber. What's your opinion of that?
I think it's coming, and that's one of the new opportunities. I think that's a huge opportunity. People used to say that we would never build another paper mill.
Yeah.
And they always said it because it was so big and it used so much water. We will build another paper mill, but it will be for sustainable aviation fuel in the South. We will do that. Yes,
well,
ma'am.
just like the paper mill like we have, I guess we still have it down there. Do you still have your paper mill?
Cedar Springs.
Cedar Springs. Will you turn Cedar Springs into something like that, or?
I think it depends. I don't know exactly what Cedar Springs produces, but most of the yellow pine goes into craft paper, which are boxes.
Yeah.
That's a pretty reliable, pretty stable industry. We all know why. People ordering things offline. So, but what we have seen are mill closures. We've seen 5 mill closures in the last 24 months in the U.S. South. Tennessee, Charleston, South Carolina, 2 in Florida, and 1 over in North Alabama. That one was probably 36 months ago, the one in North Alabama. And those were all kind of print paper, white paper, and feminine products, hygiene products type paper. That business is under a lot of stress. One thing that we have in Georgia is we have a lot of craft, the pine that go into boxes, and they go into beer cases, and they go into Coke cases. That's what our product goes into. So we're structured a little different. So I don't know if that will be the case, but they can certainly complement each other, depending on the back end of the meal.
One other quick question. You hear a lot of things. Is it true that Delta Airlines has already had to contract with Europe for so many gallons of jet fuel because it's sustainable energy? Is that true?
I am not
true.
The expert on that. I do know Delta has formed a coalition, and we're part of that here in Georgia now. Gulfstream's involved, UPS is involved. Couple of the paper products companies are involved now to look at making SAF here in Georgia.
Well, it would be really a real boost to rural Georgia if we did that.
Without doubt. That would not, it'd
And
be
they
huge.
get no tax credit.
Yeah, I'll let you guys decide that. But yeah,
Thank you.
it's coming, and I do agree, I do believe it will be.
Okay.
We'll make it.
Chairman Robert Dickey.
Thank you, Mr. Chairman. And thank you, Tim, for being here and what you do, protect our state's forests. And I want to follow up a little bit behind of what Chairman Houston was getting at. Forestry industry in our state's huge, and it's a huge asset and for our environment, for our economy. And yet I see very low returns from growing trees in this state. And we got a lot of high assets in land value and trees, but just low rate of return. And it's really affecting rural Georgia, I think. I mean, we do have some employment, but what can we do to attract more industry to use these pine trees? We're growing more trees than we're able to use. You and I were at a building in downtown Atlanta last week where they have built a wooden structure and engineered wood. And what can we do on a state level, state policy level? We're spending billions of dollars attracting car manufacturing companies, film companies here, but we're not using the wood we're growing here. And I just like this committee to look at ways that we can incentivize companies to come here and use this wood in a very environmentally sustainable way in our state. I think we're cutting down forests for solar fields and for other things, and I just think there's a great opportunity if we put our mind to it in the state to use our forestry to incentivize economically in rural Georgia. Could you comment on that?
Yeah, and that's a great point, but and also recognizing that the return is based on two things, right? It's based on income and it's based on expenses, right? It's just that's the way you figure that out. The income is has been relatively flat. There's no, I mean, you can look at UGA 1L can give us all those charts that show the income over the last probably 15 years or 20 years for private landowners in this state have been relatively flat. Yeah. And there's areas in the state where from here to Augusta where it's probably been negative because there's just lack of markets, right? So I think that's a very good question. So what can we do in this immediate to help with that profitability? And that's with expenses. I mean, because the income portion of that is so long-term, right? That's about business development and attracting new mills and getting something built. That's 36 months, 48-month project to get the capital raised, to get the permits raised, the air quality permits, all that takes time. So I think if I were asking that question, and we didn't really talk about it in preparation for this, I would think this group should focus on what could we look at on the expense side that we could help private landowners, because those have gone up too, right? The input costs have increased because of inflation.
Yeah, I want to thank you for that, because we got two areas that are fighting us tooth and nail with it. Our local tax assessors hate CUVA when we try to keep property taxes low. They just can't stand it, and we got GDOT who follows tooth and nail on trying to lower transportation expenses. So, committee, just keep that in mind as we look at options.
Yeah. So, I mean, and that is the question about sustainability, especially in those weak markets. Are there opportunities for state? We've used to have a state reforestation program, I understand, years ago. It was called SIP. It was pretty creative, state incentive plan, right? I don't know if it's time to think about that or not, where you help landowners that are replanting and you help them deal with the inflation of cost, does it sunset at a certain period of time, or do you put up a fund that just helps with reforestation cost? Yeah, just that's a thing to think about, is how can we look at, and I'll commit to give some thought to it and maybe bring back a white paper to this group about some ideas on how you can look at expenses. I think that's what you got to focus on immediately, right? If you want some immediate to help with returns, long term, we can all look at business development and recruitment, but that's a long process and it's not going to happen overnight. But good question.
Chair recognizes Chairwoman Lynn Smith.
Thank you, Tim, right here, and thank you for your presentation. First of all, I want to comment, 2020 is when you came in, but in March of 2020 is when the tornado hit my county. And you had everybody, and that's another thing that forestry does, they respond to our emergencies and had to do the tree count. That's how we knew how strong the tornado was, how many felled trees, all like that. So thank you for that. And every year in my committee, we're looking at what new innovative things we can look at and do to increase what we do in Georgia. And one of the things we've done is we now are the first state in the nation to give carbon credits for material. We're on the market. If you could explain that a little bit to people, because that's going to help people use our wood more.
Yeah, so Chairman Dickey referenced the building, the wood building being built in Ponce City. That building could have been built in traditional ways, right? Concrete and steel. But because that developer decided to use wood, they stored carbon versus releasing carbon through the production of concrete and steel and traditional construction practices, because they chose to use wood, which is recognized as a sustainable building material. 50% of dry weight of wood is carbon. That's essentially what it is. And so because they chose to use that, we, through your committees and through this body and through the governor's signature, created a voluntary carbon market and basically charged us as a forestry commission with the task of developing, for lack of better terms, an equation that you can put these inputs in, and it spits out the back end of the equation, the carbon advantage that developer gained by using wood over using concrete and steel. So there's a delta there, right? And then because it's voluntary and we are an unbiased, the equation was created with a lot of smart people and it's got credibility. That developer can take that delta to the marketplace, the change or the amount of carbon. He or she can take that to the marketplace and sell those carbon credits to a purchaser that's willing to buy those, or they can use them for their marketing materials, or they can hang on to them and do whatever they want to offset their own carbon emissions. That building will be the first building on the carbon registry. The Ponce City building will be. There's another building being planned in Buckhead, 18 stories, and they're talking to us now about being on our registry as well. That's going to be an 18-story wood building in Buckhead. So, and I talk about that when I go around the country at some of our meetings, and I say, we're completely a red state, and we've got a voluntary carbon market that's getting traction. And it's not regulatory. And so we're really proud of that, and we're promoting that every opportunity we have. We think that's a great tool to incentivize wood construction. The university system here, the Board of Regents, and Georgia Tech are probably all tired of hearing from me, because every time I talk to them, they say, well, it's $10 million more to build a wood building. And my response is, you're going to be $10 million over on budget anyway. And they just are. And but we need to really, the university systems, and this is an opportunity. They're the centers for innovation. They incubate talent, and then they send talent out into the world. So what better place in Georgia also is to have a wood building out of mass timber is on a university campus. And we're falling behind in that front. University of Arkansas has it. Clemson has it. University of Auburn. Auburn University has it. They have wood buildings on their campuses, and we really need one of those on one of our public institutions where we can spotlight that. Great work.
Thank you, Tim. Now you know why he was selected to be director. He can stand up there all day and answer questions and really keep us informed, and we look forward to working with you, and we'll be calling on you when we put our recommendations together for some things there.
And I'll commit to get you a briefing paper on on Chairman Dickey's questions. All right.
Thank you
Thank
so
you.
much. We have dinner tonight at 6:30 in the Magnolia Room, same place, or just a little bit above that, I believe. Breakfast tomorrow morning at 8 a.m. Travel to the Innovative District at 8:50. We'll be boarding a bus at that time. And our next rural development meeting will be December the 12th. It's only one day. It'll be at the state capitol, room 341. Bring your recommendations at that particular time. Any questions, anything before we adjourn?
Check out before we get on the bus at 8:30.
Yeah, there is a checkout, and they'll store your stuff for you. Yeah, they'll store. Let me say one more thing. Is Sarah Lynn still in here? Or is she gone? Get ready to thank her for everything. She shoots out and everything. But when you see anyone from the University of Georgia, they have made this particular event spectacular with the meals that they have worked out, with the meeting space, everything. And thank you to our media people, person this time, that's been here to be with us. We thank you. And thank you, Stacy. Thank you, Leo, for all the work. Vince, we appreciate you. If there's no questions, we stand adjourned. See you at 6:30. 6:30.